marketing and branding interventions, and quality assurance support to private facilities. They've been working in the county since 2023, and we can see how many facilities they've supported so far, both public and private. So it's to take a moment to appreciate is on advocacy, communication, but everyone seated in the room has a part to play. In commodities and who we can link up with to see how best to do that. Children are still dying from focus on elimination on mother-to-child transmission. You can see how all this affect RAMCA in the long run. So we are working together to ensure that maternal and neonatal mortalities are reduced. So as Ushiriki with Wema Foundation, and what we're doing with the county is trying to align all these priorities that the county has and bring together all these stakeholders to be able to have a roadmap. The county in terms of maternal and neonatal deaths, what interventions that we are well aware of. So what started doing is engage the county, and they have an aligning their priorities. And this team will be involved in the review of that, and will be able to see what each partner can do in line with the county acceleration plan. We'll be able to review it and validate it and have a launch. Political and the leadership of the county puts maternal and child. In our group, we also had the MOH representing in governance, whereby they oversee all these RAMCA activities. Areas aligned to the different pillars of EWENE, that is HPT, financing and investment. And this is key even in terms of when we are going out, what messages are we giving them? So this needs to be aligned of care at the facilities. We need to know how to give these messages down to the counties. How are we utilizing our CHPs for that? In terms of policy and building the capacity of county leadership to continue to prioritize maternal and child health issues, because at the end of the day, we require these annual work plans to be facilitated, to be put into the budgets, and continuous plans and resources allocated. So I will stop there and take any questions. Thank you on behalf of RAMCA.
Thank you so much. Thank you so much. That has been wonderful. Before we take any reactions, I want us to appreciate the EWENE champion as alluded. And when I look around, turn around, I can see Wetoto. You know, I want you to appreciate it. EWENE champion? EWENE champion? Yes. Yeah, the EWENE champion.
RAMCA team.
The RAMCA team. The lady who was presenting is very powerful, and therefore we shall put our fingers in a powerful way. Somebody's mentioning 3, I think. Fingers together 3 times, the thunder like. We appreciate the RAMCA team, and to me, more especially the. So when I say rap, Hastin. Rap, tuende mara moja ile tana. Okay. Rap. Haraka. So we are I just kid. So 20 mara moja. You are powerful. Endelea. Namna hiyo.
Thank you so much. Yeah? Thank you so much. In that spirit, I want to the Chief of Staff who has just joined us, and I request kindly to move forward. Simon, help me bring the Chief of Staff. There, kindly, Simon. Thank you, Simon. As you can just sit here because now we are team as karibu sana, Chief of Staff. Thank you so much. Karibu. Yesterday, as we were winding the day, we had a few presentations that we had, we listened, we saw, but we never had an opportunity to react. And I know possibly you kept together with this very presentation that has just been executed. It's my pleasure now to welcome all of us to interrogate the presentations that were presented yesterday and not reacted on, and the one that has just been presented now. So welcome. Simon, you will help me move the microphone unless there is a delegation elsewhere if you are had. Who is going first? Yes, there's a hand there.
My name is Luke. I work for Inside Enterprises. And my question is to the team from Cambridge. We are trying to advocate for integration of new technologies and innovations in how service delivery is rendered at county level. One of the things we are encouraging is when a county adopts an innovation, we're able to do an impact evaluation, maybe after 1 year or whichever period that the county decides to do that, so that we can be able to gauge what is the return on investment for these new innovations that are being deployed at county level. So I understand that you provide technical support and you are a research hub. In such a context where the county has deployed a new innovation, and they want you to support them to evaluate the impact of that innovation, is that something that you can do? Putting in mind that this is not a funded project, so it's more of you coming on board and providing that technical support to evaluate the impact of that innovation within the county. So is that something that falls within your scope at the moment for the work you're doing with Bungoma County, or there's a possibility to discuss that? Thank you.
Thank you so much. We shall take a round of a few questions before we allow the responses to come in. Any other? That is so, Camry, take note of that. Any other? Yes.
Good morning, ladies and gentlemen. Thank you very much, Waziri, for being here the whole of yesterday, and all of you for coming very early. My name is Collins Juma. I work with TICO. We are in the triple threat space, supporting our young people to make sure that the demographic dividend that we've been looking for as Africa is achieved. So I just want to point out a gap. It might be small, but very significant. So when you look at the area of commodities, especially FP commodities and HIV commodities, there has been instances where us as partners, there are stockouts. And you know, if a young person goes to a facility, especially the public ones, and there are no commodities in those facilities, there's really not much that can be done. That's why we know this. And we don't do so much in terms of advocacy, because our focus is supporting, like greasing the process for young people to come for the services. and the person who gives us the money, UNFPA, is the same person funding commodities. So there's no way you can tell UNFPA that we again went to Bungoma and started buying commodities when it is the same commodities that they have sourced. So the area around improving the LMIS, how we account for the facility, the commodities on the platform, is an area that I have not seen us as partners and even the MOH deal with it. So I would want us to try and see how we can bring ourselves together, synergies and process improving the LMIS.
Thank you so much. I hope the Secretariat has taken note of that contribution. There's a hand behind there.
Okay, thank you very much. I'm Wangila. I conduct monitoring and evaluation at the Department of Health. Thank you, the presenter. However, there are some gaps that I realize you didn't come out clear with the priorities of the next financial year. And as a department, I think we are not done over by the planning. Please liaise with our planning team. Then we see the priorities from your side. Thank you.
Thank you so much, Wangila. There was a hand that side.
Thank you so much for the very wonderful presentation. My concern would be on the issue of SHA. I really want it to come out so strong because as a county, most of the mothers that we are seeing are not able to access services because they either do not have identity cards or either they are adolescents, they are not able to access SHA. So I would really want the issue of SHA to come out in a very strong way, and that would make our work easier and even make mothers access care. Thank you.
Yes, there was another hand around there.
Good morning, everyone. Good morning. My name is Sharon Hania, and I work with an organization called Basic Needs, Basic Rights Kenya. We are in the mental health space. I'd like to read a few things, like the studies that have been done in the mental health space. The first one is about 1 in 10 Kenyans is living with a mental health condition or disorder. About 42% of the services we provide in the primary health care, people are having symptoms of depression, severe depression. Then mental health, we have a mental health treatment gap of 75%, meaning many people who need care do not receive it. Every day in Kenya, 4 people commit suicide every day in Kenya, and among those who have committed suicide, 10 of them, studies say 8 of them are men and 2 are female. So most men are the ones who are committing suicide in our country, Kenya, and 50% of mental health conditions begin at the age of 14 years. So we have a very big gap that we need to address as a county in the mental health space. And also in our organization, we support access to preventive and restorative mental health services. We support social inclusion of persons with psychosocial, intellectual and cognitive disability, and we also continually improve policies through research. To the county government of Bungoma, we've identified a few gaps in this space, which the first one is the capacity of our staff who are working in the mental health space. For example, in Tongaren sub-county, we don't have any psychiatrist, nurse, psychologist. If they're there, they've been designated to other duties. So we have a bigger challenge there. Also in terms of drugs, psychotropic drugs, there is a few, like when it comes to budgeting, it's under budgeted. And the last one is limited integration of mental health to primary health care. Thank you so much.
Thank you. As you sit down, I want to restructure it and also say we had a partner that was dealing with mental health. So the question I would have maybe brought out to that partner in connection with what you have brought out. What can this partner help us as we, the county government, also endeavor to do that? I think the partner that was dealing with mental health, you are the same person. Thank you. Okay, fine. Thank you. We have a question here. Okay, fine. Okay, fine. It's okay.
Yeah, thank you so much. Good morning, everyone. My name is Kibet Jono. I work for Misha Afya, and I want to appreciate the presenter, the Ewene champion. We welcome that so much. First thing, I'm sure RMNK and HIV are very much related at the TB. And you didn't list us as one of the linked areas that you want to work with. I saw you work with the PTU, the finance, but I want to draw the attention that we really were waiting for the presentation so that we actually make this comment was really. Ewene, which is, I want to start from there, which is every woman, every newborn everywhere. As a county, our ANC coverage is around between 69 to 73%. Betting we were discussing with you. And the first ANC is where we do everything that we want to intervene. I want to link this from where we are sitting here. The mother-to-child transmission rate that we have as a county. Currently, we dropped from 14.5 to 8.61%. My question is, from the team that I've said, which are basically our 4 programs in terms of reproductive health and maternal child health, what can we do better to bring in resources to improve on the first ANC and also reduce the the mother-to-child transmission? We've seen progress, yes, but we are not yet there. Nationally, we expected to come below 5%. So that was the concern I had, so that when we are working with the RMNK team, we will be able to understand how we can work together. Thank you so much.
Thank you. Let's have one last before we get the reactions. Simon, this hand has been up for long. Then we go for the responses. Allow one more. Okay. Go ahead, Laurie.
Okay, good morning. Okay, I have a question on to Ramka, the Insight Health. I'm Doreen Kinanga, the primary health care coordinator. And the reason why I'm asking this question is because of the support of the referrals and the ambulance dispatch. Can you expound more on the ambulance dispatch? Because with the maternal and child and the reason for also issue on PPH, how are you going to support the county on ambulance dispatch and refers from the community to the facilities? And also, you can also expound on the issue of benchmarking. Yeah.
And that one.
Good morning, all.
Good morning.
My name is Paul Lodi. I coordinate TB. I wanted to bring to attention to the Ramka team a few facts about TB and the child and the mother. Because I didn't see the link. In 2019-2020, Moi University did a research on neonatal death. The results were 24% of the children who died at birth were due to congenital TB. And that results meant that we are not doing enough at the ANC. Currently, when you look at our screening, because screening for TB is across everywhere, the ANC and the antenatal ward and postnatal ward, they are screening at 1%. It's supposed to be at 100%. So that area we have neglected. If we look at our data, the children, the 14 and below children who died due to TB, the 80% of all the children who died are below 1 year. What does that tell you? It tells you that this mother who is pregnant is the one having both the pregnancy and TB, and therefore passes it to the child. So if we don't do anything at the ANC, then even if we do all those things, at the end of the day, we are going to lose the child and possibly lose the mother. So please, as you plan, don't forget, there's something called FANG, Focus on Natal Care and TB. Please, I want a partner to take that seriously so that we have children born healthy, even the neonates born healthy, and also the mothers raise children while they are healthy. And lastly, on Monday, we shall be bringing a very big machine in this count of ours. We are going to bring an IGRA. IGRA is the interferon gamma release assay machine. And this machine will be able to detect if you are exposed to tuberculosis. It's going to come here. This will be only the 8th one in the whole Republic. So I request colleagues, I take this opportunity that we use that machine. The healthcare workers who are exposed to TB daily, now it's the opportunity to come and check whether you are exposed to TB. So that if you are exposed, you can take preventive therapy. And on Monday at the PCRH, we shall have a CME for the healthcare workers. This machine has been brought because sometimes Bungoma was leading number of healthcare workers dying because of TB. So the machine is there. The good thing about the machine was there is also that it can be able to test blood. That if you buy the cartridges, you don't need to take your blood now to Eldoret. Just use the machine here. And then you screen all your blood here. Thank you very much. That's information I wanted to pass.
Thank you.
One more, please.
Thank you. My name is Wilkista, ICFM Mission. My concern is just on disability mainstreaming. Maybe I didn't get the partners. There are a number of partners who are in disability mainstreaming, and we wish to map out, because our activities are mainly focused on rehabilitation, and there is this gap on accessibility. We did an accessibility assessment for hospitals that are offering eye health, and we found that there is a big gap in accessibility, especially for people with disabilities accessing services. And you know, we need to advocate for inclusive health. So requesting that all partners that are dealing with disability mainstreaming, we really need to do a lot on accessibility. There's a big gap in that. And then we need to concentrate our issuance of assistive technologies so that we know which areas have been given. Like ICFM has done a lot in Bumula, Kimilili, Bungoma North. So we need to concentrate in areas where we have gaps. So kindly those who are dealing with disability mainstreaming, let's put our heads together, synergize our efforts and services so that we do a good job in the county. And then there is, we did an outreach in Mount Elgon on eye health, and for Cambry, we realized that so many children in Elgon are suffering from eye health, especially they are called allergies. So whether we can focus some research on what are the causes and how do we manage or reduce on those effects. Thank you.
Thank you so much for the wonderful presentation from the RAMCA team. My name is Rose Mogoi. I'm the Cancer and Non-Communicable Diseases Coordinator. I was just wondering from the presentation, your focus is much more on maternal health and child. But along that, we are all aware that cancer is the biting
problem currently worldwide and even Kenya. In that support that you give to the county, how well can you integrate cancer services for these women? Because our leading cancer for the women is breast and cervical. If the woman will be having a pregnancy and a coexisting cancer that has not been detected, still will not achieve that goal that we want at the end of it. As we move towards integrated care approach to our patients, our partners supporting RAMCA, kindly, how can you come in and support the cancer space that really does not have any partner supporting that and any other incidents? Thank you.
Simon, you need to regulate. Let me, I know we shall come for the second round of questions. Just hold on there because responses, much of the responses were like comments. We had a few questions. I think Kemri, there was a question for Kemri. Please.
Good morning, everyone. My name is Emma Oma. I'm here for Cambridge CPHR and under Moms Project. So the question that came out clearly was if we are supporting the evaluation of impact of innovations. I would like to respond this way, that we are just coming. We are in the preparatory phase for this project. And maybe to give a bit of light, Kemri is a bit big. It has different centers. And as we are here in Bungoma, we are here as a project of moms, which is mothers micronutrients supplementation. So we are supported or funded by Novo Nordisk Foundation as well as Gates Foundation. And the funding that we have currently is specifically focusing on enhancing the supplement for mothers. So other things I know will come later as we move forward, and this is something that we can present to the DG for more discussion on how best we can continue supporting on other areas apart from the micronutrient supplementation. Thank you.
Thank you. Team Ramka had a few questions. Possibly you can give them an opportunity to respond.
I feel like Ramka should have a whole day because some of the items that we have wanted to present, we have answered most of the questions. So I take you back to Ewene, and what we are focusing nationally and at county level is we aim to achieve 90-90-80-80. 90% of mothers attend 4 or more antenatal care visits, 90% scale deliveries, 80% postnatal care within 2 days, 80% of mothers have access to emergency obstetric and newborn care within 2 hours. So back to the 90% attend 4 or more antenatal care. We are all aware that when they go for the first NC visit, and someone mentioned that, they receive integrated services. So as I was trying to present the different causes of maternal and neonatal deaths, you could see that HIV is there. Pulmonary diseases are there for neonates. HIV is there. Cancer being an indirect cause of maternal mortality will also be there. So we could discuss this a whole day as Ramka, and I think with the county we'll organize for a meeting that I can facilitate to further explore this. And it will be with all the partners. And as much as I didn't mention the linkage with each and every individual, it's because they are organized in the different pillars. So we'll have a session whereby we can be able to go in detail with the Ewene Coordination Committee at the county level to be able to explore all this. There was another question on financing and investment and SHA. I think that one I will leave to the county.
advise us.
Thank you. Just a takeaway as you hand over the microphone. Possibly what we are looking clear are the indicators on that template. We appreciate there's other material, but we would love to see the indicators very clearly outlined on that template, so that we can be able to track. That is why I think how the question was coming. But otherwise, we appreciate for the larger things that you are doing. Thank you. Was there any other thing?
Good morning. So I want to respond to the question that was asked, that was addressed to Insight Health Advisors. So my name is Rebecca, and I work with Insight Health Advisors. So just a little background. So there's a project called Public Sector Scaling of Health Innovations that we are implementing in all the counties of the Lake Region Economic Bloc, of which Bungoma County is one of the counties in the 14. So all about this project, we come to the counties, and the counties are able to identify priority needs in the health systems that needs to be addressed. So from there, we make a call for innovations. So anyone who has an amazing idea that can address these needs is able to apply, and then we do shortlisting, and we're able to get the innovations. So that's how we were able to get ambulancy and yoga. So the question was about ambulancy. So the county is able to adopt this innovation called ambulancy. So ambulancy is a web-based dispatch and coordination platform for the public ambulances. So how it operates is similar to what Uber does. So once the county has already set up a dispatch unit, and let's say there's an incident somewhere, or maybe there's an expectant mother who is in a bad state. So what happens, you at the scene, someone is able to make a call to the county where the dispatch unit is. There's a toll-free number. When the county gets to that level, it will be able to have a toll-free number. So once they call, the person at the dispatch unit will be able to locate any most available ambulance within that vicinity, and able to dispatch that ambulance with the emergency medical technician to be able to support those patients. So number two, the question was on benchmarking. So as I mentioned earlier, this project is being implemented in the 14 counties. So that means there are counties that have already adopted these innovations, and they are already at the scaling level. So we support the technical working group or the representatives that have been selected within the CHLT or the technical working group. Sorry. So what we do in terms of benchmarking, we support selected members of the technical working group that will be established at a later stage. That's something we're going to discuss with the CHMT much later today. So once we, for example, if it is ambulance, we have Trans Nzoia County that is already has a dispatch unit. So we support this team to go to Trans Nzoia to see how the dispatch unit is working. How did they, from the start to where they are right now, how was the process? What were the challenges, and how did they address the challenges? Those are all about ambulancy benchmarking. NeoGuard, a neonatal vital sign monitoring device has already been adopted by the county. So through Neopenda, the ones behind the NeoGuard, they were able to donate 10 devices. But as it was presented, there's a deficit of 40 devices. So again, what we do, we try to identify like-minded organizations and also third-party funders who are willing to bridge this gap. Thank you.
Thank you so much. I think.
Thank you. My name is Esther, although I work for TICO. I have two questions, but they are directed to the Secretariat.
Oh, you are on the questions now?
Yes, related to the RAMCA group.
I wanted to see if we have exhausted the responses for the previously asked questions.
Let him go.
Thank you very much, Waziri and the entire hall. Good morning. My name is Ekada Dennis from Ampath Population Health. I wanted to touch on two matters that were raised. One was where these partners around the Ramka space contribute to management of NCDs, and then two, I'll touch on POCUS. So Ampath has three programs that deal with the cancer screening. We have Canon, that is the Kenya Nepal Oncology Network. We have Imara BC that deals with the breast cancer. It's a new project. And then we have within POCUS, because part of our primary role is for early screening and detection of breast cancer. So we're dealing with obstetric conditions, that is early detection of any complication. Then we're looking at breast screening, where we're able to identify these masses at the low facility level, and then we look at cardiac and lung issues. So far we have deployed 144 devices across all the 10 sub-counties. Those are 118 facilities deployed. All level 4s. I know our level 5 has a POCUS device. These are handheld gadgets for ultrasound. And then all level 3s, all level 4s, all level 3s, and 70% of level 2s. So once you can reach any dispensary now within a radius of, let's say, the second facility must be having an ultrasound, a handheld ultrasound gadget. So the only challenge we are facing there is underutilization, because we trained 507 healthcare workers, that is last year. We are planning for another mop-up training coming up in the next month so that we cover those areas that we had not filled up. So the only thing is now I'll ask the committee here and the department to help us in, we had terms of engagement. We signed an MOU. So there are asks for us, that is as a project, and there are asks for the department. So in terms of just utilization of these devices, the healthcare workers were trained. We have an issue with the arbitrary transfers. So there are facilities that we have these gadgets lying idle because whoever was trained there has been transferred. So as a project, when we monitor and a gadget is not being utilized, we have no option but maybe to withdraw and redeploy it. So that's the discussion we'd want to have with the department. So utilization of these devices plays a key role in cancer screening, that is at early stages. Our women, our mothers are able to be screened for breast at the dispensary level because those nurses are well equipped. So that is the discussion. We'll need to proceed with the department and see how best we can make use of the available resources. Thank you.
Thank you. I believe our secretariat has captured it clearly. Now I think we can move to the last round of questions, and I want to give a guidance. Kindly, when you are asking, bring out what are you asking. Just go straight to the thing that you would want to know, so that we avoid more questions, more stories, and then we save time. So we are just going to take a few, then we go to the next stage. There's a question behind you.
Yes. So direct to the question to the Secretariat, my question is in co-financing. So with the donor landscape as it is, with the shrinking funds and looking at a more sustainable funding options, a lot of partners are looking towards co-financing with the counties. So as TICO, we are currently supporting about 3 counties in co-financing MOUs to be able to support in the service delivery of FP to adolescent girls and young women. So my question is to Bungoma County as to whether there are any plans to go into co-financing of some of the interventions that we have in place as partners, mostly for sustainability and for the shrinking donor funds. That's my first question. My second question is on SHA, again, because I'm very concerned for my girls, our girls. So the integration with Taifa Care is structured in such a way that they have to either choose whether it's insurance, cash, or SHA. So we're working with 15 to 24-year-olds, as Betty said, who do not have the documentation to get SHA. And FP primarily, they also need to get to have either of the three to be able to access FP services, which is a huge blocker for us. So what are we going to do in terms of exploring possible exemptions of adolescent girls and young women to access FP services without having to go through the SHA route? Yeah.
Thank you. I think that is any other? Can take one more, then we come to respond. I know we have a lot of questions directed to the county government. We need to respond to them. Thank you.
Thank you very much, appreciated. I sit within the RAMCA group, but I have a question for the Secretariat and the partners at large, building a case for the media. So straight to the question, what is our relationship with the media? Who is holding us accountable? How are we holding ourselves accountable? So that would be my question very briefly. Much as I sit in RAMCA, I'm seeing it's overlapping, like now the media being a megaphone. Yeah, I know there's trade relationships. There's an assumption that the media only exposes the bad side of things, which is a narrative that probably want to debunk. So not to go into too many stories, let me just leave it at that. What is our relationship with the media? How can we capitalize on it in terms of media products? Beyond me having probably journalists coming here at 10 and then capturing this story, it's out in the media. Beyond that, how are we capitalizing on this relationship with the media? Thank you.
Thank you so much. Simon, I can see you want to pick something. Welcome.
Thank you so much, our moderator. I'm called Simon Mukoko Simiyu. I'm the Partners Liaison Officer in the department. I'll give my contribution to the two inquiries, one on co-financing issue. The department is very intentional and very deliberate on co-financing. We take this as an innovation that is here with us, and we are going to embrace it going into the future. We are cognizant of the fact that the donor basket has been dwindling over time. And yet we have a lot of investments lying with the private sector. So instruments like PPPs are well embraced in health department. As we speak, we have a co-financing mechanism already underway with AMREF and TICO, whereby we have actually signed an MOI with them, where we're going to finance an intervention in RAMCA. So for the speaker, that is a platform that we embrace heavily, and you are most welcome. On media relationship, thank you so much. And I think if I'm speaking on behalf of the leadership, the moment we saw a media interest in this summit, we were very, very, very excited. The last time we had a very structured engagement with media was around 2018-2019 with a media partner called Internews. And Internews engaged us after doing research about Bungoma, where we had cases against the facilities, cases against health practitioners. And some of these cases, the way of putting it, were very sensational. There was lack of strategic reporting. There was, on the part of the media, and also on the part of the leadership, we had a gap of crisis communication. So the fact that media is coming on board, we would like to engage media in a very structured way, whereby we get to understand your concept of your intervention. We onboard it, we co-create the scenario that we want to address, so that most of this reporting is actually reporting that should be about the gaps that are existing on one side, and also on a positive side, what the department is doing so well that has generated a lot of demand, and the demand is actually overwhelming the supply side. So we are very keen to engage the media partner in the house, and you are most welcome on that. Thank you so much. Now on the show, I welcome one of my colleagues to respond from the Secretariat.
Okay, I'll try to respond on SHA and Taifa Care. For primary health care, we know we have three on, we have the SHIF, and also we have the emergency fund. So we get a primary health care fund from the exchequer. So all level 2 and level 3, they're not supposed to charge. They're supposed to offer free services to our clients, whether they come for a family planning, delivery, NC, or even outpatient, because they get refund from the primary health care fund, which is from the exchequer, from the treasury. So we don't expect a patient getting family planning services to pay. So that's what we're supposed to do. No, it's already happening in the primary health care facility. Level 4 also, they have signed an MOU with SHA. They're going to family planning, the clients under delivery, the clients go to a level 4, if you're a paid up member, you use the SHA to pay for your services, mostly inpatient and some few in the outpatient. And then when you go to a level 5 facility, that's where we don't offer primary health care services. That's why we request matibabu wapi? Mashinani. Unaanzia kwa community level where there's a CHP. CHP walks into your household. They do household visitation every month. They're able to identify people who are sick. They're able to even to take blood pressure. They're able to test the blood sugar. They're able to identify and do mapping of these pregnant mothers, and they're also able to identify the disability. They're able also to identify even the postnatal mothers or even the defaulter. So we request all people from the county of Bungoma so that to make sure that you start your at the community level. Identification of a patient from the community level to a primary healthcare facility to a level 4. When you go to level 5 facility, the PH fund won't work there. You need to be a payable member of SHIF. So if you know you are not a payable member of SHIF and you have gone for family planning services in level 5, you're not supposed to start from a level 5 facility, start from down. If there's only referral cases, which are supposed to be taken care at the level 5 facility. So I think I've tried to respond on SHA. Thank you. So I'm requesting that through the media that to make sure all our clients are registered on SHA, and we have been having the RRI on IDs and birth notification. They count on the 45 votes for the since from 10th of June. So we used to request everybody to make sure they've registered, they've taken IDs, which now takes only 2 weeks. Even if mother is, we have done mapping of a pregnant mother today, is at 12 weeks. The time anaenda kujifungua, already atakuwa amepata nini? Kitambulisho na ameregister SHA. So the time you start planning, that's why we say you need to do a birth plan as a pregnant mother. And that's why we have the CHPs in this house. And CHPs, you can pass still the same information. We have been doing RRI of registration of IDs in the whole Bungoma County and birth notifications for those who didn't. So I'm still requesting that you need to start kutoka wapi? Chini. Don't go to the level. Thank you.
Thank you so much, and sanitation. Now, as we I've been notified that our tea is ready. We want to move to. I want to welcome the deputy director who will further welcome the executive to make their comments. Karibu daktari.
Thank you again, Daktari. We request to change the expectation a little bit. So we want to summarize what we have been doing from yesterday up to this time in terms of looking at what our partners are doing, mapping the activities that the partners and the activities that we are doing in our sub-counties and the county as a whole. So to finalize this program, we want to make sure that we have captured all the key action points that we've talked about. So the Secretariat has captured a few action points. We want to get consensus with you. And if we have left anything out, free to add to this so that as you work on the report, we shall be able to capture all the reports, all the issues that we have discussed. It's not projecting. Yeah. Yeah, so this is a short exercise in 5 minutes, and then we shall proceed to have our tea and come back for the closing session. Okay, so maybe you can increase the font. Are we able to see? They can increase the font and maybe bold, make it in bold. Okay, so I can read for those who are not able to see. The very first action point we have captured from yesterday's presentation. We saw that a number of us, some of us have been around for a while, and maybe we have not formalized our MOUs. And there are also those new partners who are coming in. So the very first action point is that we are requesting you engage the secretary, make sure that you have a formal. So we shall be going through the process of, but the number one action is we have your information so that we facilitate the formalizing your MOU. The action point we've captured, of course, the responsible person there, we shall fill that in. That will be with the Department of Health. Then we have completion to come up with the first draft of our partner mapping reports through the contribution that we look at it and complete and make sure that we have actions that can show where we can partner and collaborate. And then finally, we shall share the final report with all of you. After break, we shall be presenting a summary of the proposed to validate and finalize on the coordination framework. We cannot buy blood. We can only get it from our fellow human beings. And the process of actually getting schools, and we'll get blood from the students, but now it's against the law for you. So it's a challenge on where we can get this blood to put our efforts together to coordinate and be able to give blood for free. But we have a few consumables that are still within blood donation. We understand that we also have it's not yet equipped, it's not yet complete. So for partners, yeah, so the next from this summit is that we have of Health Bungoma County, which will happen sometime in September 1st, that we need to integrate. We realize that people are actually sick and they stay at home. If you want to know that there are patients who stay at home, I think there's some time, 2 years ago, it was around the time when we had facilities, and our private hospitals did not have patients. So we were wondering on stretchers. We had patients coming from home, high blood sugars, and we realized that most of our people just stay at home, sometimes due to mop up an integrated medical camp. Patients who are at home who have not been attended to a long time. Engagements, we shall also do SHA registration. Not registered on SHA, we shall give information on the myths and misconceptions around SHA. Some people fear SHA, as Dr. Doreen has said. Some people fear even appearing to a health center because they fear that they'll be told they have to pay. But for primary services, the access is completely free as long as the patient has registered. So we'll have an opportunity to educate the population around SHA and also get them registered. We also hope to mobilize to have the population also registered for IDs, which is a key document that is required for SHA registration. TB screening, we'll have NCDs, we will participate in your space here. Blood donation will also happen on that. To think about supporting this medical camp. SHA registration again came up yesterday. As we have talked about all the activities that patient who's at home, and our aim is to have good. We mobilize them, sensitize them about what we are offering. If they cannot come to the facility and actually be assisted with the SHA cover that they'll be having, then we have not achieved our target. So we have actually not had any partner who's supporting or advocating for SHA registration today. So it's an issue that we have also noted as a secretariat that we can look into, because at the end of the day, we can talk to the mothers, but if they don't have the SHA cover, they are not able to come to the hospital. So it's something that we can also incorporate. Lastly, we have talked about engagement with media as a key stakeholder. It is true, for most cases, you find that maybe there is that constrained relationship with media because often you find that maybe they're reporting on the negative side. But as we've been told, we can actually embrace them as a stakeholder and make sure that we are passing the right information in a timely manner so that we don't have the citizens wondering. And, you know, sometimes when information does not get out, people start to speculate. And we have many teachers in the community who may not teach the right thing. So we can have an opportunity to engage with media as a stakeholder so that we pass the right information at the right time. So this is what we have captured as a secretariat. If we've missed out any action points overall. So in terms of working together as partners, of course, that was the objective of this summit. So through the coordination framework, we shall see how we can work together. We have established structures in the coordination framework on how we can work together as a whole unit, and also how we can work together at thematic area sections. As we go outside here, we can also just meet as reproductive health partners. We can meet as community health services partners, but then we shall have, annually we shall be having an engagement where we have all the stakeholders coming together to share the experiences that they have had through the thematic areas. So that may not be captured here, but we shall expound when we talk about the coordination framework. Thank you very much. Any additions?
Thank you so much, the Secretariat. A round of applause to the Secretariat for helping us understand. Thank you so much, led by our Deputy Director, for making us understand better issues that have been arising. Now, team, I wish, now I know we came here very early, and it is time to go and re-energize ourselves. I'm told there's a cup of tea that is outside there, and we want to go and spend something like 20 minutes. And we come back, and right now it is 10:15, and I'm looking forward that we shall be here by 10:45. Thank you so much, Waziri. Now, in that spirit, may I request one of our spiritual leaders to bless the cup of tea so that we can go and take it. The cup of tea is served outside here. Any volunteer? A volunteer? Thank you. Kindly, please.
Can you stand up and pray for the cup of tea? Our dear Heavenly Father, in the morning as we gather together, want to commit even the tea, that you sanctify them, for we pray this trusting in the mighty name of our Lord Jesus Christ. Amen.
Thank you.
Was it on?
Kuja. Weke hiyo kitu. Sawa. Hizi zimekuja hapo tu taka tuweke tu, tunaweza weka kwa kona pale. Hey, what is that? Nimeweka pale kwa hiyo kona. China. Nimetoa. Nimeweka attention. So, attention.
mbaya. Jana nilikuwa kwa bwana. Mechaji ilikuwa kamera imekatika katika tu. Sako na shodi bwana.
Ngoja tuone venye hali itakuwa. Kama basi nakaa maji.
Kwa fikiriria itakuwa ngumu.
Mfanye maji. Sawa sawa. Charge your wifi. Ile kwa power ya wifi.
Wanafika kama wako Lamu, like your travel day na wapata lunch za kazi by around 3 wamemaliza. They travel from Lamu to day one, then wanalala watu travel ama kama kuna flight jioni ya hiyo day 3, I mean day 4, kuna flight ya Tanariva jioni, they can travel back to Bungoma.
sharing stories. Natunga sheria gani? Ile pia ingine. Yeah, this one is my cohort and yeah. Yeah. We can get settled. And being a Friday, where everybody knows what is expected, and we don't want to between that Friday. I also want to encourage you. Could have maybe having a proposal, a comment, or a reaction. But you may have to ask a piece of paper and forward it to the secretary. They can continue compiling those ideas to form part of the report of this and part of the action points. As the deputy director, when she was presenting, she said we are open to the additions. So kindly, I know we could not give everyone a chance to ask a question or give his or her recommendation. I am urging you, take a piece of paper, you have a notebook there, and forward it to the secretariat. Where is the secretariat seated? May I see the by a show of hands, so that teams, one desk ya secretariat iko hapa mbele, but there is another one somewhere katikati pale. But if you forward in front here, it will reach to the right place. So please don't remain with that idea. Make sure that idea is brought forward. Someone said that any idea not communicated is as good as nothing. So I want to urge you to communicate that idea so that we can turn it into reality as a team and as partners together for the benefit of our community. You are looking forward to having everybody come. Mr. Wetoto, kindly get me the deputy director out there. Yeah. We want to get to the next thing. As we had mentioned, we are going to present the partnership framework. This is a document that is in its draft form. And this document is meant to bring sanity in the coordination of partners and the department, so that we can have a very, very clear structured engagement, a very, very clear structured way of coordinating issues and activities, and more so to lead us to that output, the high output that we expect to achieve. So when that document comes to fore, I want you to give a keen scrutiny, and we really welcome your input so that we can enrich it and even make it better, because this document is meant to marry us together. This document is meant to help us achieve better when we all embrace it. That is where we are headed. Once we are done with that, we shall have a few reactions as we start thinking on how to end the day. Thank you, Simon. Just a reminder, we have 2 registration forms outside there. If by any chance we used a different door or you walked in without registering, just there, kindly I request that you kindly just go register and continue and come back and continue to relax. It's very important that you are captured in those forms. I repeat again that we have registration forms at the door behind there. There are 2. You are supposed to sign on both. So if in any case, by any chance you did not, then I will urge you to do so as I prepare to welcome our Deputy Director to take us through the partnership framework document draft that we have, and then from there we shall be expecting to receive your input or reaction, and we shall be glad to incorporate. Okay, you can come and set the machine as we are waiting for the executive to arrive. Possibly as we are just, maybe there is something you feel you wanted to give a comment. As we are waiting, I welcome your comment. If maybe there's something you feel you want to comment, I welcome. Anybody, possibly there's something you want to share? Yes, yes. Okay.
Okay, good morning. I'm Fred Baraza, the County Multi-Sector Coordinator for National Syndemic Disease Control Council. I just wanted to share that we have trained chiefs, ACCs and DCCs on online reporting system so that they can be reporting real-time gender-based violence issues. So their partners who are supporting GBV would wish to also partner with them so that we can synergize the fight against GBV and the triple threat. Then I want to also state that we are also doing a lot in syndemic diseases, that is HIV, TB, malaria, and non-communicable diseases. We'll also wish to engage partners supporting those areas so that we can also increase the fight against those diseases. Then we are having something called Hay Graduation and World AIDS Day celebrations. So Hay Graduation is normally attached to the coordinator VTP, and sometimes we celebrate them with the World AIDS Day.
So good morning, everyone. So I also wanted just to make an announcement that Kibabi University has an ethics and scientific and ethics review committee. So for those organizations that wish to get ethical approval for their researches in the county, can apply through the university. It's approved by NACOSTI. Thank you.
Oh, thank you.
That is beautiful information. Yes. Very, very beautiful. A quick rejoinder to Fred regarding you asked about you want the report. I want to inform you the Secretariat is working on the report, and once it is complete it will be shared to all partners, but you are the MOH wewe ni serikali utapata. Thank you so much. You had something? I'm taking any reaction, maybe anything you want to share. You are welcome. Yes.
Thank you. Thank you so much, Mr. Ure. This was just a rejoinder on what my sister brought out early in the morning on aspects of men with the issues of suicide and struggles of mental health. Sometimes we always say that we need to be intentional about issues. For a very long time, we've struggled with this issue of boy child, and I don't know what are we going to do as partners so that during our engagements, we can involve the boy child with a lot of intentionality. Thank you.
Thank you so much, Jesse. That is a good one. I know the Secretariat is capturing those issues, and the partners are also listening and picking them. Then there was another hand somewhere. Yeah.
Good morning, partners.
Good morning.
Ninaitwa Nabie wa ICFM Mission that runs Dreamland Mission Hospital. Yesterday when we were presenting about ICFM, I thought I should add on something else for people to know so that they can make use of it. We have a very good newborn unit at Dreamland, and have a small funding to help very needy families that cannot afford to pay. So when the children are born, those ones that need that critical care, and you think it's a mother that cannot afford, you can send them to Dreamland. Some of them can get assistance from there. The place is running 24/7. It's a good place. And then secondly, I know that those of you who would like to get CT scan services, ICFM has one blessing. We have a new, the most current 64 slice Siemens CT scan. But the most critical part of it is not just that Siemens CT scan. I am connected with 50 professors of radiology who read, interpret CT scans, and they work through a local radiologist in Kenya to read, and reading takes 20 minutes, 30 minutes, it's done. So when you come to Dreamland, the chances are that if they do the CT scan and they make that report, the chances are that your condition is being seen by a very high up experts who can help you to identify the problem better. And we have a very strong referral system with the hospitals, especially more in Eldoret and in Western Kenya and in Nairobi. So that's the better blessing you have. Dreamland does not just stop there. It has a very strong network of referrals for help. And then we are preparing, just about ready to start functioning with an ICU of 7 bed. We have procured equipment. We are remaining with a few equipment, and then it will start working. Our interest is to make sure that people who could access don't miss it. Right now, the demand for that is so high, and not many people are able to find the few that we have within the county. I think that's something I wanted to bring over. And one challenge that we have is that most hospitals have a challenge with the disposal mechanism of waste. Dreamland has a very good incinerator that can help. If we talk, depending on your capacity, we can make a small subsidy for you, and you can clear that, have that waste nicely sorted. So that's what I wanted to add on.
Thank you so much. Thank you so much, Director, and we appreciate how you are adding value to health in Bungoma County. Ladies and gentlemen, I now want to move to the next stage, and we are, on the screen there is the Health and Sanitation Sector Partnership Coordination Framework. We promised you that we are going to give you a presentation of our draft document. And it is a document that is going to be a game changer in the way we interact and the way we deliver services and the way we partner together to ensure that the people of Bungoma are getting value for what they deserve. Allow me to welcome the Deputy Director to take us through. A round of applause as the Deputy Director is coming. Thank you so much, Daktari. Karibu sana. Thank you.
Thank you. Apologies if I have stood here to present is a high-level summary of what will source visibility and sustainable health system strengthening and maybe health system strengthening and maybe health. And at the CHMT we are currently working through them together so that they can work together. To ensure that they came up with this idea that we want to do a coordination framework. This is how I want my partner to come. The other one will say this is the way I want. Your right way is not the other person's right way. So a bit, and then you find that at the end of the day we are not able to put the resources that we have. So we thought, how about, so we have all the key stakeholders participate and we agree that this works for me, this works for you. This works for me, this works for you, and this is you, and this is where we can refer to where, and for new partners we can refer to where, and for new partners who are coming in, let's structure to where, and for new partners who are coming in, let's structure. So these are partners who are coming in, let's structure. So these are county-led. The stewardship of partners to be county-led. The stewardship of partners to be county-led. The issue of resource tracking. So once we have committed that this is where the progress. Of implementation. Quarterly, we want to talk about sustainability as well and transition. So you have come in and you have really helped us to achieve these. Indicators. So why this framework? I think we have had this discussion from, and what we actually have, not what we have. We have realized that as we were planning for this committee, we thought we'll have around 30 partners, but as we progress, you realize that there are so many partners that do the facilities and we don't have them in our database. So there is need to actually have this framework so that we can map all of you and register all of you and be able to account for all of you. The next issue is also the coordination gaps. As you can see, there was fragmented engagement. There is duplication in some instances. We've had cases of duplication where a partner is implementing an activity and another one comes to implement the very activity. So through this coordination structure, we shall streamline that so that if all partners come through the same entry points, we can be able to advise that what you want to do has already been done. Kindly either move the location or shift the focus so that we cover the other areas of need. Geographical as well. You saw yesterday, Daktari said no. do we still of them? But I think there are areas that are not covered, mostly geographical. 8 times to record that area. We need to look at that for the community health services. Be on a specific area and follow only on that. But if we can come together, then we can have what we envision through different mechanisms that we establish, and also have joint implementation where that is possible, through maybe the quarterly data reviews, if we can have joint data reviews for all thematic areas, and learning and transitioning, and also accountability. Yeah, so this is the vision, the goal and the objectives of this framework. I forgot to say that this is meant to run us for 5 years. So this is from 2026 to 2031. So at that time, we shall plan to have a review so that we see any gaps we may have missed out, so that we can be able to come up with another, review the document again. So the vision is overall to ensure an effective, coordinated contributing to the health outcomes for the people of Bungoma. And the goal is basically to strengthen coordination, alignment, accountability, partnerships, to improve service delivery and optimize resources and ensure equitability. So these are some of the components of this document. So we are going to talk about the stewardship, the governance structure. We also talk about the database. We want to establish a database for all partners, where we have all partners coded and you can be able to account for you. The structures, we shall also establish the structures that will manage these partnership roles for each stakeholder. We want to identify the stakeholders that we are going to work with around the county planning documents. We also, and finally, sustainability and innovation. Yeah, so this is the flow of what we want to ensure that they have aligned to the county priority. And these are the areas that they can support. We shall expand this. So financing, the technical assistance, we may have maybe commodities or health, and depending on the area of interest, and also the county price, the engagements, we shall look at that in detail. And finally, those are the results that we mentioned: digital health, infrastructure, equipment health, and the NCDs. We have nutrition and food safety organization, among others. I know we may not contribute to better quality of care for health areas, but this is what we were able to analyze so far. So the stakeholders, we try to identify the stakeholders that shall work. Stakeholder is the county government and public sector. We also have the national agencies. We have the civil society organizations and CBOs. We have academia, where we have our schools and universities. We have the partners and donors, and we also have the private sector, the faith-based organizations, and the other NGOs. So these are the stakeholders that we shall work with. So in the documents, we have outlined the roles of each of these stakeholders. And we have also established a stakeholders forum, which shall come together once annually. And today, actually, what we are having is a stakeholders forum. So if you're seated here, I know you can identify yourself among the stakeholders. So the county government basically will provide leadership and strategic direction on what we want to do. The national government gives us policy directives that we follow as the county. We have the partners and donors who support us in implementing these activities. We not miss there. And then finally, we have the civil society organization, community. but it's well elaborated in the bigger also for your inputs. So this is the governance structure that we proposed. So some of them are structures that have been in existence. The only new thing here is the county health sector partnership coordination framework, that was a committee that was not in existence before. But otherwise, through this document, we are formalizing all the structures that have been in existence, not formally. Yeah, so we have a county health stakeholders forum, which we are having today. So this comprises of all the stakeholders. And this is the biggest accountability forum. Karibu sana. Yeah, so this will be the biggest accountability forum, which we want to hold annual meetings like this, so that now we can have all the stakeholders coming together to consume the reports that governance structures. So this is the overarching coordination committee. So this is the committee that we are establishing now, and this is a subcommittee of the CHMT. So this in the director's office, and the membership are the chairs of the database of all partners. We shall communicate through the partnership secretary, all thematic areas having technical working groups. So this one, you are able to give reports to the director, depending on the number of sub-counties. So depending on the number of sub-counties. So and to support you and make your work and the members of that platform will be the same. So that depends if you're handling RAMCA, that will be supporting you together with the MOH. Then we have facility or maybe make a courtesy call to the to go straight to the HIV clinic. So when you go there, the process, and they'll be able to report. So when you go there, the process, and they'll be able to report back to the director's office, where we can now access those reports through the committee. Also, a few members that have been outlined in the document, the functions of this committee. If you have a few questions, you can capture, especially on this, but for more elaborate, so that you give more comments. Okay, so this is some that you give more comments. Okay, so this is how complex your organization is, but for me, for minimum requirement to support something, they come through the director's office. We've had some that come to facilitate your engagement. So submission of a concept as we prepare the MOUs, and then we shall formalize. Very busy, but this is describing what you do in 5 years. Yes. The exit. So number 1 to 8 is basically the entry point, and number 9 to 13 of interest through a concept note to the department, and then we shall have initial review by the partnerships committee. Once we have done the initial review, where we try to understand which area do you want to support, what is your budget, what is your proposal, or what is in your concept, we shall now engage the key stakeholders in officers that you will be working in the department, look at preparation of just confirming that you are a registered CBO organization profile, you committed to see these many patients, you are that. Then finally, as the partner, we want to ensure that we have learning and adaptation, and then we prepare for transition and exit, while ensuring that we have sustainability for the achievement that have achieved throughout that period. So we shall use these tools. We've talked about a common strategic planning. So as you do your strategic planning, I know the years do not necessarily align with the county or the government years, financial years. But at the point that you're doing your planning, your strategic plans, can you kindly try and engage the county so that you plan according to the priorities that we have at that time. We shall use MOUs and agreements depending on the kind of engagement that you have with us. We shall have a common budgeting and expenditure review. We shall also have common monitoring and evaluation processes. Also, resource and stakeholder mapping, and also joint review processes. So, of course, the tools can shift depending on what you are implementing in the county. But what we want to encourage is that we work together. We plan together, we review together, and also we come up with sustainability plans together. So these are the commitments that we want to commit to as a county. We shall commit to lead and steward partnership coordination. We shall set clear health and sanitation priorities through our planning documents. We shall work together to review and approve the interventions that you want to come and do in the county. We shall convene forums through technical working groups and review platforms, which is also involving the partners. We shall maintain the partner database and resource maps, and we shall support implementation, monitoring, and learning. And finally, we shall ensure equitable distribution, public participation, and sustainability processes. So for the partners, we request you to commit to sharing your work plans, budgets, locations, and expected results. We also require you to align the support with the county plans and service gaps. We encourage you to participate in planning, coordination, and review platforms of the county so that you can learn where and how we can align. Report activities and outputs quarterly to the committee in terms of resources and challenges as well. You can report on that. And also we encourage that we use a common reporting platform, that is the Kenya Health Information System, so that we're able to have the data to account for the data that you're actually generating. So avoid parallel systems and duplication, and also plan for capacity transfer, transition, and exits. We don't want a situation where you're surprised. You're told that, by the way, what I was supporting yesterday, today I won't be coming. Sindio? Yeah, so that is it. In summary, we shall share the document for more details, but this basically covers what is entailed in this coordination framework. Thank you.
Thank you, Director. Just hold on. You know, you've given us the spirit of partnership. I want to welcome Collins CJ to appreciate our Deputy Director. Collins, in the spirit of partnership.
I have the privilege to use a mic.
Of course you have.
You hear me behind you?
You have the privilege.
Thank you very much, Eure, for this opportunity. Ladies and gentlemen, my name is Collins Juma, and on behalf of all of you, partners, Madaktari Mashinani, and all participants, thank you very much, Daktari, for this opportunity. Hapa si ndo iko kazi? Si hapa iko kazi? Sasa nataka mtengeneze ya nyayo. Wale wanajua loyalty pledge, hebu nione mikono juu. If you know about the loyalty pledge, mkono juu. I know hakuna Gen Z hapa. I was looking at the room yesterday and I know sisi wote ni loyalty pledge. Sasa tutaunda 1, 2, 3. Mmesahau vitu ya nyayo? Funga, fungua. Lakini hatutaki mkutano ifungwe kwa sababu wakubwa bado wako hapa. Asante sana. So tutatengeneza makofi mzuri. Asante sana. Madam nisiseme director, kumbe unajua pia huko wakati ya Moi ilikuwa ukitaja mtu vibaya unaweza futwa kazi kabla utikae chini. Kwa kazi nzuri ambayo umefanya, umetusaidia kushughulika na mambo ya afya. 1, 2, 3. Fungua. Thank you.
I didn't know, Collins, that you can also be like that way. Thank you so much, Collins, on behalf of the partners for appreciating our Deputy Director. Ladies and gentlemen, I think you've seen what has come in a nutshell is something that has affected all our thinking, because it is going to touch us. And I know this is going to be our Bible. I want to take this opportunity now to take a different trajectory. We have many visitors in the house. We have our executive. And Deputy Director, I hope you are breathing. I'm just giving you time to breathe and take a sip of water so that you've been here on a power-packed presentation. Allow me to return you back to welcome our Chief Officer, who will in turn take over to welcome the visitors and introduce the visitors that are in the house. Thank you so much. Karibu. A round of applause for our Deputy Director, which is coming again. Thank you.
So thank you very much. Allow me to close this temporarily. We shall come back to this. So we want to take this opportunity to acknowledge the presence of our guests that we have today. So we have the Chief of Staff in the house, Dr. Manyasi. We also have a member of the Health Committee of the County Assembly. And I take this opportunity to welcome our Chief Officer to say a word and welcome them to say hi to you. Thank you.
Good morning. Yes, it's another blessed day. We've had one day yesterday, very fruitful, and now we are coming to a close. Our Ziri, our sector committee member, Mheshimiwa Ambulwa, our Chief of Staff, Secretariat from sector, our valued partners, our colleagues from the CHMT, and the teams from the ground, the METSUPs, MOHS in the house. I feel privileged again to stand before you, and I want to say this engagement has really yielded the fruits that we were seeking. Our Deputy Director has clearly given us the roadmap of where we want to go. I want to assure the team, the committee, as the accounting officer, that immediately I will facilitate you people to go into a retreat. We have no time, we have no luxury of time, so that you compile this report and give us a clear roadmap now on what to do. A few comments which I picked. Tico mentioned something about commodities, the shortage of commodities. We have a gentleman here who has come up with a very good proposal. There is a subsidy discount from the Bill Gates Foundation that wants to support the commodities. I looked at the figures that he showed me, and what KEMSA gives you at 8 million, Bill Gates will discount it to 4 million. So I think we need a political support from county to national through the governor, so that we can onboard that facility, so that we can reach as many people and people who cannot afford drugs on the ground. That, I think,
We shall work very hard. We've discussed with Waziri. We have the political goodwill of Mheshimiwa here. When KEMSA does not do full fill rates, we've been going to METs. Why can't we plug in them to fill that gap? I think we shall get more facilities. Without really politicizing the facility, it is the same products, but at discounted rate. So what is our objective of being here? To serve our people and serve humanity. That one I'll push kadri ya uwezo wangu. Ikikwama nitaongea na waziri, ikikwama nenda kwa governor mpaka tuta. We shall achieve that because there are no interest in that. It is a question of serving our people. I also spoke to Mheshimiwa 2-3 days ago. We had gone to the assembly on the issue of Ebola. We really wanted the buy-in to support us. You know, it is the political wing that will speak to wananchi and sensitize them that there is this thing. And for him, he comes from the border ward. What they were requesting, and I want to report that Domisha have some little budget which we can do facilitation of MCS to go within the border areas and talk to the people and see. Because without political goodwill, we had an experience of Alupe when the national MOHs landed there. And they did not land. So we do not want the same experience in Bungoma. I think we have very reasonable MCS. We spoke to them and they were happy. We shall just need to hold their hands and see how they can support us, speak to the wananchi whom they govern. I want now to introduce the secretariat, I think led by Paul. Paul, just say your name and then the lady, then I'll leave Mheshimiwa to be introduced by Waziri.
Thank you, Chief. Good afternoon. My name is Paul Mudoga. I'm the Committee Clerk, Health Committee, County Assembly of Bungoma. Thank you.
Good morning. Good morning. I'm Karen Wanyama. I'm Clerk Assistant, County Assembly, also working with Paul in Health.
And finally, on media. I think there has been a misconception that we've not worked well together. I think starting today, we want to open our doors and we have positive engagements so that I know there's a lot that is happening in the health sector. And if we engage positively, I know many things will come out well. The county has done a lot. Last week, the governor was supervising the new beds, 50 beds in our 300-bed capacity. So what have we picked as media? And many other things that have come on board. We shall engage you na tutafanya kazi pamoja. Waziri will speak more on that. So I know Waziri has a lot to give us the clear roadmap, and he will stand here and do a clear summary on where we want to go. So let me give him an opportunity to come in. Then he will welcome our member of assembly to give his remarks. Then he will do the closing. Thank you so much.
Thank you very much, Chief, for that powerful presentation. And I want to take this opportunity to welcome our member, County Assembly, and also member of our Health Committee, and also representing the chair for this function. Karibu sana, Mheshimiwa.
Mheshimiwa.
Thank you, Waziri. Our CEC Health with the team, our partners, Madaktari Mashinani, and all members present. Good afternoon, good morning. Good morning. My name is Jack Wambulwa, representing the good people of Kimaeti, a member of the Health Committee, and I'm also here to represent my colleague chair who is away on official duty. First of all, I want to take this opportunity to thank Waziri for coming up with this kind of engagement. It's long overdue. As a county, I think we've been lagging behind for simple reasons that we've had several donors in this county, but none of them is known by the leadership of the assembly. What I mean is that when we have donors, they need to declare themselves to the executive, come up with MOUs, so that it's brought to the House for discussion. We know who you are, what you intend to do, how much you need to invest in, so that they can also guide us as an assembly during our budget making to be able to actually balance out. But if we just go quiet like that, we might be duplicating what each other is doing. So may I take this opportunity on behalf of the Health Committee to first of all welcome our donors and partners on board by a clap and an applause. As Bungoma County leadership, we support donors coming on board. We cannot achieve it in health without donors. Previously, we are doing so well. We had several donors. In between, I think something went wrong somewhere, but it's now back on track. I also want to take this opportunity to thank Waziri. Najua huyu Waziri ni kigogo ya mambo na devolution. He's been there for long, tangu gatusi. And being an experienced CPA on matters finance, matters health, that's why governor entrusted him to bring back to health. But you can see stakeholders who are present, including the civil society. I think we are now back on the right track. So I want you to applaud Waziri for the same. I'll be very brief because I want us to move on. Ladies and gentlemen, our emphasis will be on partners coming on board. Please, we request that you disclose what you intend to do with us as a county, because we also want to come in and support you. I'm very sure there are even areas of counterpart funding. So if you don't declare, it will be very tricky for us to imagine that you are doing it rightly when we are not partnering. It's important that we expect you to disclose what you have and exactly what you are doing, so that as a committee of health, we are aware and be able to bring it to the attention of the House. We also need an engagement policy, which of course will be approved by the county assembly, so that as you move, you are legally recognized and you are doing the right thing at the right time. Disclosing your financial support does not mean that we directly need that money, no. But we just want to know what you intend maybe to facilitate us. Is it in terms of technical training? Is it in terms of material or trainings? That will really guide us as an assembly, that even during our budgeting, we'll already be aware that indeed we have partners on board to support us. So we can maybe take that money somewhere else to help the same people of Bungoma. What do I mean by that? That by doing so, we also expect you to tell us your achievement at the exit. Maybe after 5 years, what have you achieved on behalf of the common man in Bungoma? That's why we insist on disclosure, so that na sisi pia tuweze kutembea na nyinyi. Chamno, nataka tu kusema karibuni. jisikie nyumbani. Bungoma is a count of peace, is a count of mlembe, that everywhere you are, from wherever you come from, feel free to mingle with Bungoma people. Sisi hapa hatuna goons, watu wanaona mtu amekupiga ngeta ama nini. Bungoma hiyo tabia hakuna. Na pia kama wewe ni mzee, jivunie kukutana na Naliaka na mjuane vizuri, akujulishe Bungoma inakaaje. Na kama wewe ni mrembo pia, Wanjala pia yako ambaye atakuonyesha Bungoma inakaaje. Bungoma ni town ile mzuri sana, watu wengi mtapenda, and we expect you to bring in more donors. We are praying for you that mfikirie zaidi ya hapo, mtuletee donors wengi on board, but we are going to support all of you as an assembly. Thank you and welcome to Bungoma.
Sorry. Allow me speak from here, because I think I have several things to pass across. First, I want to appreciate Mheshimiwa for that powerful speech. Our partners who are here today, our team, honorable members, and clerk of the committee, Fourth Estate, and all other guests that are part of us here. This is the second day that we are engaging over this partner summit. And as Mheshimiwa said, it is going to provide a direction on how we are going to engage. And this event did not just happen. Actually, we want to appreciate some of you partners who supported this event to be realized today. And I want to call upon them. They will stand. Living Goods. I don't know where they are here. Living Goods. Thank you very much. Ambath. Thank you very much. Ushiriki Wema. Thank you very much. ICFM. Thank you very much. And then LifeNet. They're out. Thank you very much. Kidogo. You see, they are not kidogo. I think they are supposed to be kubwa. I don't know how it will translate that. Little Sisters. Thank you very much. Kemri. Thank you very much. And then we have Health Rights. Thank you very much. Actually, we cannot finish this session without actually having some of your representatives just to say something. You know, it will be one side of discussion, yet we are partners. So there are three partners whom we feel they can say on behalf of the rest. That is Kemri. Will say something on behalf of others. Then ISFM. Then Living Goods in that manner. Karibu.
Waziri, thank you so much. So to Waziri, our distinguished guests, county representatives and officials, fellow partners, ladies and gentlemen, good morning. So I take this opportunity to thank all of you for giving me this opportunity to be here today. and greetings from our principal investigator, Dr. Zipporah Bukanya, who is currently out of the country. The greetings. Thank you. So my name is Emma Ouma. I work with Cambridge CPHR under Mom Study as a study coordinator for the project. And first, I want to appreciate the county for really supporting us from the start when we were getting into the county until today. The things that we have done in this county, the few things and the few milestones that we have done, is really because of the support from the county heads, to the facility levels, to the sub-county, and even to the community and the CHPs all combined. So we really appreciate that. And also, this summit is coming at the right time, especially for us who are just coming in. It's really going to strengthen a lot. It's not only the program and the processes that are coming up, but also there will be a lot of impact at the society level, at the community level, and even at the processes of integration and also collaboration with the county at large. So thank you so much for the health and sanitation team for organizing this forum. We look forward to more of such forums. I don't want to clarifying a few things that we are doing. So, basically, as Mom's project, we are trying to enhance UNIMAP. It is on folic acid supplementation, then moved, combined, then to UNIMAP. And currently what we are doing as a Cambridge CPHR Moms project, we want to enhance the UNIMAP, to add more supplements, to add more micronutrients such as DHA, choline, as well as nicotinamide into what is existing, so as to see the result of this. And we hope that by the end of it all, mothers are going to be healthy. Children, we are going to deliver healthy children. We are going to follow up these participants up to 1 year post-delivery. And if we have funds, we will want to even follow up them beyond adolescence, just to see the neurodevelopment, the physical development, and all other forms of development that these enhanced micronutrients will bring to this facility, so to this community. So maybe to just clarify also, we have the project is multi-phased. We have like 4 phases. We have done the first one, which we did around March and April, which we completed. This was covering the whole county, and I want to really appreciate the county government, the facilities that we were working with, and even the CHPs. They really gave us a lot of support during that time, and we were able to even collect data within a very short period of time. That was around 2 to 3 weeks, which we are currently analyzing, and very soon we will be able to even disseminate the results. So we are moving to the next step, which will be acceptability. We want to see if this product, is it going to be acceptable? If we give it to the women, we know how the challenges that comes with pregnancy,
if we give this supplement to women, will they be able to accept it? Will it be good for them? Will they be able to tolerate, comply, and even adhere to it? Because we will not be doing much if they take it and they vomit. They are not able to tolerate. It's not going to be absorbed. So we want to see, is it going to be accepted by the pregnant women themselves at early stages of pregnancy? Then later we will do the RCT, whereby now we will improve that. We'll improve the supplement according to what data we have to make it more pregnancy friendly on that. So basically, we are looking forward to work with different facilities at different phases. In the next phase, we are going to work in Tongaren, sub-county at Naitiri. And then later we will be working with Bumula and Sirisia sub-county. And during this period, we look forward to support the county at different level, especially at the facility levels, by doing renovations where needed, especially at Bumula sub-county hospital and Sirisia sub-county hospital, to meet the standards of research, so that even when the PPB comes and other bodies of research come, during the inspections, they are able to see that these facilities are meeting the standards of research. About the summit, I would not want to dilute things that have been said by other members. This is coming at the right time. It's a bold step. It's timely, and it's also a visionary step that is coming to all of us as partners, and we really need to embrace this process to ensure that it continues. I know Deputy Director mentioned that this is going to be annually, so let us continue participating, let us continue embracing it, and for even the partners who are not here today, and you know maybe another partner that you are working closely with, inform them. Let us embrace it and also create awareness about this, so that next year we can even be more alert about this. This is a good platform for learning, a very good platform for engagement, a very good platform for dialogue, and it will also strengthen us as we continue to deliberate, as we continue to deliver to the community at large. So we are looking forward to continued support, Tari. We are looking forward to continued support as we are going to the next phase of our project, which will start very soon. We are just waiting for some approvals from the PPB, that is Pharmacy and Poisons Board. Then we will be here for the next phase of the study. So thank you so much for the collaboration and the support, and we look forward to more collaboration as we continue. Also, we look forward to walking this journey together to ensure that we have healthier mothers, healthier babies, and even a stronger community. Thank you very much.
Next. Okay, thank you very much. While we were going on, I think I want to recognize the honorable member for township. Anaweza wasalimia kidogo.
Amen.
Hamjambo. Naitwa Mheshimiwa Jeremia Kuloba Makabeji. Mimi ni MCA wa Township Ward. Karibuni tuendelee naye kazi ambayo tunafanya. Thank you.
The ICFM.
Thank you. Hamjambo tena. waheshimiwa, Mheshimiwa chairman wa komiti ya afya, kwa heshima yako, Mheshimiwa kutoka township, Makabeji, God can do wonders. And I remember meeting this gentleman somewhere, and when I heard him speaking one time, I knew that God can do something from nothing. And we really want to thank you. Thank you for coming. I would have missed you. Mheshimiwa Bwana Waziri, pamoja na viongozi ambao umeambatana na wao kwa usimamizi wa afya ya kaunti yetu, viongozi madaktari ambao mko hapa, viongozi wa partnerships wote ambao mmekuja hapa, very special guests indeed, hamjambo. Kwa sababu mimi ni Mkristo na tena nasimamia mambo ya Wakristo na wananchi, ningependa niseme Bwana asifiwe. Amen. Inaitwa Nabii Solomon na natoka ICFM Mission. Mimi ni msimamizi, mwanzilishi na msimamizi wa ICFM Mission, Director General of ICFM. Na ICFM ndio ina run Dreamland Mission Hospital na program ya Believe na zingine zote ambazo tunafanya. Na ICFM iko Bungoma, a little bit in Kakamega, a little bit in Busia, and we are preparing ourselves to be in all the counties of Western, the Lake region, God willing, next year. Yangu itakuwa tu machache, lakini italenga sauti ya partners. I am speaking on behalf of partners. I will not now speak about ICFM. I would like us to speak about partners, because by the chance, by muujiza wa Mungu, I have been around in Bungoma for over 30 years. For over 30 years. I know a little bit of history of what has been going on in Bungoma for years. Some of the things that we know and love so passionately, some we have seen them come, na zikaenda, like, I will not go into that. But sahi, let me give you the benefit of my experience to talk about where we have come from and how partnership in Bungoma can grow, because I have some experience. Na Bwana Waziri, partnership katika lugha ya Kiswahili ni ndoa, ni marriage. And by the way, marriage yoyote, a man is the one who determines the quality of marriage that exists. The quality of a man determines the quality of a partner that comes into his life. Ni ukweli ama ni uongo? Wewe ukiwa hivi na wanawake pia ambao wameona mbele, hawatakuwa karibu na wewe kama wewe ni hivi na huyo mwanamke ni msomi kama hawa wenye tuko hapa, na mheshimiwa amesema wako hapa, lakini wanaangalia kwa macho waone huyu mtu ni hivi ama mtu huyu ana maisha ya kesho, ndio aamue kuenda kwa huyo mtu ama namna gani. My experience has been that Bungoma has been like this, and mheshimiwa amesema vizuri. One time we were attracting so many partners, another time partners were running away from us. But may I take this chance kwa niaba ya partners hawa wenye wako hapa to first of all thank you mheshimiwa msimamizi wa komiti ya afya, ya kwamba wakati wako uko favored na Mungu. Which means there's something in you that God likes. Hata maneno umesema ni mazuri. La pili, kutupatia huyu mzee kama waziri, na wakati kumekuwa na msukosuko, mimi nilikuwa hapa na mkutano, nilikuwa natarajia aje, nikaambiwa tu hakuji kwa sababu kuna mambo fulani, kumbe kulikuwa na kiti imevunjika. Mimi nakangojea hakuji, baadaye nikasikia amerejeshewa kiti yake, roho yangu ilifurahi.
I hope you played a role. Tupigie makofi huyu waziri. Sisi kama partners, we are excited that we are now functioning in a happy, enabling environment for partnership under your leadership. And if you stay around for a little longer, not just until we go to the next election, tunaomba Mungu yoyote atakuwa governor mwingine, watuachie wewe uendelee huko for another 5 or 10 years. This Bungoma will not be the same. Ama namna gani? Boma mzuri inakaa kama baba aliyonko. Na huyu mzee namuona ni mfupi lakini mrefu, anaona mbali. Nasema asanteni sana, Mungu akubariki sana. Ya pili ambayo ningependa niseme wapendwa ni namna hivi ya kwamba partnerships. Saa hii I speak from the experience that my major job at ICFM I try to seek partners and retain partners. Like I have worked with some partners for the last 30 years. The last 30 years, and they have never stopped. And there is a secret that is there that involves attracting and retaining quality partners. Attracting and retaining quality partners. Unajua saa hii tumefurahi, umetuambia what we should do, and Madam Director, asanteni sana. I was longing, you saw how I was disturbing you kwa chakula. Na ukaniambia ngoja. Na nikaona from what you have presented, you are right. I am satisfied you have given us a roadmap of engagement, and that is from the side of government, members, partners. Tumeridhika mapana. We now know where we start from, and we now know where we get to in Bungoma County. But now, there's something that is remaining that we want to make an ask for from the government. Sisi tunangependa tuombe tu kwa unyenyekevu serikali. Kwa sababu umetupatia hii roadmap ni mzuri sana. Kabisa. Ni ya lami. Lakini inahitaji tukue na road signs na vitu kama hivyo ili tutembee kwa hiyo barabara mzuri. I have a few comments to make na nikishamaliza nitakaa chini. Ili to attract partners, sio tu wale ambao tuko nao hapa, na hata wengi wenye wako na pesa. Juzi I was meeting some senators in Washington DC. Senators were US, and I was discussing something about development in Kenya. And one thing that as one senator told me, a US senator told me, that Kenya is a powerful nation. Kenya is a resilient nation. And if you come from Bungoma County, make sure that Bungoma is friendly to partners. And there is no shortness. There's no hakuna ukosefu wa pesa kama partner saa hii ako mzuri. So Bungoma hii, in terms of infrastructure development, in terms of programs, in terms of projects, in terms of capacity building of personnel, we are if we make our house in order, hakuna ukosefu wa pesa uko ulimwengu. Pesa itakuweko. Ama namna gani? Yes. Na kitu kizuri ambayo serikali ametufanyia kwamba government has given us very well trained people. Hao watu wamesoma ukiangalia CV zao wamesoma. What they lack is facilitation. What they lack is funding. But some of these partners can help that facilitation to come to pass. If we can make the house more attractive to partners. So there are 5 things I would like to say, Bwana Waziri, when you come to speak, that we like to make an ask for on behalf of the partners. So that if these things are put in place, we will do our part, you do our part, the county will become a different place. Ama namna gani? We do our part, you do your part, and then the county becomes a different place. 1, attracting partners. Attracting partners. Ya pili, engaging partners effectively. Ya tatu, retaining existing partners so that you can get the most out of it. Ukioa nilikuwa kwa harusi ingine, I trained church leaders and ministers I have an office in UK. I have many people I'm working with. I'm setting up another office in US. And one of the things that I have been interacting with and listening to, I listen to how pastors talk. I was in another meeting and a pastor was talking about marriage. Na alikuwa na counsel watu ambao wameoana tu siku hiyo, amemaliza kuwaunganisha, na pastor anaambia kijana ambaye ameoa, anasema wewe ni bukusu? Akasema ndio. Unajua kupanda viazi? Akasema ndio. Viazi ukitaka iweke mapuoni mingi unafanyaje? Akasema unaweka hiyo kamba yake chini kabisa kwa emumbu, ndio naweke mchanga kubwa, ndio mapuoni kuja mingi. Akasema wewe chukua hii msichana, enda weke kamba chini kabisa ili mapuoni kwe ngapi? Mingi. Bwana Simon, hii partners, usipoweka kamba chini kabisa, hakuna mapuoni inaweza kupatikana. Ama namna gani? So that's something I like to say. How do you retain partners and make sure that when you have a partner who can give you 5 children, don't just get 2 children and be contented. I know that people are talking about family planning, but family planning has to have a future in mind. You can talk about family planning when you have only 2, when God wanted you to have 5 so that you can come and lead the whole clan to transformation. Be careful. So make sure that if she can produce 5, get at least 3 or 4. So as partners, let us get the most from our partner. If our partner has potential to give you 10, don't be contented at 2. And seek to have meetings like this, Bwana Mheshimiwa. These meetings isikuwe tu hivi na Mheshimiwa hawezi kusema Mheshimiwa kwa assembly mweke tu budget. Unajua hii partners hawa Kemri na wengine. In fact, I was discussing in the US about US iko na kitu ambayo ni mzuri sana. Wana government pillars of research ya kusupport states, lakini wana other private performers, private groups sime set up other pillars. They call them towers of research. Na walikuwa wananiuliza, does Kenya have a faith-based research institute apart from Kemri? Nikasema I don't know any. Why can't Bungoma have the best faith-based research in medical, in clinical research and others, so that it's funded and can be established in Bungoma, so that you can be the example for the world? And it only costs something like 50 billion. Akasema, where do I get 50 billion? Akasema, get organized. Money is not a problem. So what I'm trying to say is that narrow minds limit you. Ama namna gani? So Mheshimiwa, if there is a possibility of these people to bring 30 billion, Bungoma County receives 13 billion only, the whole county from government. If health can bring 50 billion, why can't you give Waziri enough money like 30 million ya kuengage partners kuwe na mikutano mingi ili tulete pesa mingi? Give him enough money to have meetings. Na hiyo meeting at the end of the year, aonyeshe we gave you 30 million. Did you bring 100 million or 200 million? And if I am alive, you give him 30 million, I will be responsible for making sure we multiply it by 10 times. So that something happens. So those are things. Now that is the voice from the partners. The voice from the partners. We would like to engage deeper and see how we can do that. And then the other point, the third point, I said, how do we, efforts must be made around retaining existing partners and sucking the most. Umalize supu ya partner. Kama ametoka ngambo, ametoka Kemri, ametoka wapi, amekuja mwenyewe, amekuja Bungoma. Amejileta. Do everything you can to get everything from them ibaki hapa Bungoma. Ama namna gani? Even if it means kumupapasa vizuri mpaka uzae wote wakwishe ndio akitaka aende bila kila kitu. Ama namna gani? Yes, so that's something that we need to do, Mheshimiwa. And we need to have a department that engages with partners, so that department is not just a said talk about partnership office. We need a serious office with secretariat, with the computer, so that sisi tukienda huko vitu yetu inaenda chap. Hao wasomi wako kwa hiyo office director wako na watu wanatusaidia kuandika MOU haraka. Ama namna gani? MOU haraka vitu isikwame haraka vitu ili pesa ikuje. Ama namna gani? Na ikwenda pesa, ikuwe na gari partnership. Akitaka kwenda kusupervise mmoja huko Bungoma, asingoje gari ya waziri apate lift. Ya apate tu kwa pick up yake ya partnership, wafike huko urgently, hii kazi ifanyike haraka. Ama nasema mabaya. Ona kama mimi ICFM Dreamland naongea na director hajakuja huko, hajakunitembelea. Sasa hata even in this, even my friend is here, Life Care. Has the director visited Life Care? Life Care should have a cup of tea with the director, with all these things, so that they see what you are doing. We should not miss you. You should be very close to us. Ama namna gani? Na msitupatie mheshimiwa, usitupatie mtu ambaye yako busy huko anatakana atibu wagonjwa na huko anasimamia partnership. Hiyo partnership is a full-time job which is going to run a budget kubwa. One time I told you I have experience. One time kulikuwa na mzee anaitwa Katumanga, who was the chairman of NAT. Na mnajua what happened with Katumanga? Katumanga was the chairman of NAT, na he was a primary school head teacher. So one time he was defending, na mambo hiyo shida ilitokea hapa Bungoma na Kakamega. Walimu walikuwa wanapoteza mshahara yao at computer imekula, kwa sababu walimu walikuwa wanapata mshahara kupitia kwa county council. Si unakumbuka mzee? Walikuwa wanakuja hapa, wakifika hapa mwalimu ametoka Sirisia na baiskeli na mtungi ya mafuta ya paraffin, kufika hapa shilingi 400 peke yake, at computer imekula. Katumanga akakutana na NAT, wakaitana na minister na president Kenyatta Nairobi. Na Katumanga akawa ako hapa kukutana na rais, na huko AO kutoka Maragoli hapa anapigia simu Katumanga, anasema sikukupatia ruhusa kwenda kukutana na rais huko, na anataka kuthreaten mwalimu mmoja kutoka huko Sirisia anaitwa Steven Siku. He was a representative of NAT wakati huo. Alikuwa kwa hiyo mkutano, akainua mkono akasema, "Rais, I have a point to make. How can we let huyu Katumanga, chairman wa walimu, the whole country, is a headmaster in the school. He's being harassed with an AO. Now huku is coming to represent the whole interest of teachers in the country. Kwako computer na kula mshahara ya walimu wa Bungoma." Na suggest ya kwamba kuanzia leo rais waamue ya kwamba chairman wa NAT akipewa tu chairman anakuwa national figure, stops being a headmaster kwa shule, ili asikuwe harassed na AO. Na Kenyatta akasema kuanzia saa hii case Barclays Bank mfungue milango na KCB, walimu wote mishahara iende kwa bank. Na kuanzia saa hii chairman wa NAT, secretary wa NAT, they are official government officials, they stop being head teachers in the school. Sisi tuko tunatetea hapa representative wetu wa partnership in the county, waziri, tafadhali kumulipa yeye mshahara hata kama ni daktari wa 1400, hiyo sio kitu kama ataenda kuleta bilioni 4. Let us have a full-time office ya kuturepresent ili mambo yetu iende haraka. Ama nasema vibaya? Mambo yetu ifanye nini? Iende haraka. Kama ni Simon huyu akue full-time. Mimi nikienda Washington DC nataka mtu anaenda kuongea juu ya afya ya county, nisijibebe bweke yako nichukue na mtu anachua pot. Wakiniuliza swali nasema Simon you say with this senator tutoke na kikapu turudi nyumbani. You see what I'm trying to say? But I cannot do that without you having given that permission, because hata nikimwambia Simon nataka kwenda wewe asema bwana haiwezekani. Sijapewa ruhusa, nitafutwa. Those kind of things. And I want to ask that mheshimiwa ututetee ili ifanyike. Ya ina nilikuwa nasema increasing partnership involvement. Increasing partnership involvement, shifting partners from implementers to strategic contributors. Right? I like this thing of inviting us here. Now, since I was I have been existing in Bungoma. This is the first time I'm getting a serious meeting here. Nasikia huwa zinapangwa. Mmekuwa na zingine? It had to take this man coming back to be a minister ndio ifanyike. Yes. Makaratasi yuko wameandika good program. Hao watu wako nazo. But to implement them, it never happens. Umenye jizu kujinga liwazi. You see what I'm trying to say? Do you know that in this country is imeenda mbali kuliko sisi Bungoma? Province, watu hawana uoga kufanyia watu hao vitu, iwe ya serikali ama nini, hawana uoga. Kuna siku nyingine tumutumu hospitali ilikuwa inataka machine ya CT na vitu fulani, haikuwa na pesa, wakaita rais. Rais alipoingia huko Kenyatta, Uhuru Kenyatta, he just ordered finance ministry. He ordered finance ministry, wakapeana 100 million, wakasema tumutumu wana treat watu thousands. Give them, after all, they are Kenyans. Give them Kenyan money to do Kenyan business. Hapa Bungoma, hata kupata tu 5,000 mheshimiwa, adiendeko tu, hata walipitisha kitu at private hospitals, especially faith-based hospitals, and is to get some staff assigned to them. Do you know that Bungoma County is the one county that is flooded with professionals that have no jobs? And that is one of the most serious abuse of that patient's money. Imagine you are using 90% of healthcare money in Bungoma is spent on salaries, paying professionals who are not been equipped to do the work. They just sit, you go to Kimilili, you go to another place, you have clinic officers who's only work 2 hours, 3 hours, and wanapalizana kitu wanaenda kwa sababu hakuna pahali ya kukaa, wagonjwa hakuna, they just come there and go home, they get full salary. That salary is patient's money. That's a very, why can't you send some of this staff to hospitals that are having work for them to do? Because they are serving Bungoma people. Ama namna gani? And demand some subsidy in return. And you see what happens. Give me some of them at Dreamland and see what happens. So this is what I'm trying to say. Let us use these professionals. Wakikaa a professional kaa miaka 2-3 bila kufanya kazi yenye alitrain, anakuja kuwa stella, anakuja kuwa tu mtu wa kuuza mboga tu kwa soko. Ama namna gani? Let's give them serious work and not partnership in engaging our professionals is a very big thing. Finally, members. Building long-term sustainability with partners is very key. Now, in each one of these points, I have some facts I could have explained, but I'll hand it over to Kiongozi so that you can look. There's no time to go into. I'll hand over those facts. Each one of those points, how do we make it work? But there is something I want to say about long-term sustainability. I like what Madam has done. I wish I came with a sweet I should have given you. You've done a good job. Shared vision, roles and responsibilities very clearly outlined, accountability mechanisms made, expected outcomes clearly, and I like what Waziri alikuwa anasema, what is our goal? I like that. What is our goal? What are we really aiming at? Those are the good things that we want to achieve. However, we need to ask ourselves a few questions. And these are the questions I'd like us to take away from here. What makes our county the partner of choice for health investment globally? What can make our county? How can somebody in India wants to invest in high technology level? We are busy sending our patients to India. What will make somebody, an investor in India, want to come and invest in Bungoma? Can we create a partner? Juzi, tukapeleka slit lamp that costs over $1 million shillings, Webuye Hospital has not had a slit lamp for a long time. Wako na daktari wa macho, lakini hawana microscope ya kusaidia huyo daktari aone wagonjwa. Kuingia hivi, mimi sikuenda.
One of my staff alikuja akaniambia, director, I think next time I might not want to go. Leta gari. Needs to be worked on. Grown outside their mindset. It is not easy. Kama unafikiri kupata pesa ni rahisi, uliza huyu mheshimiwa. Kungangana tu hata apate pesa tu ya serikali imekuja, lakini kupata tu ili Ministry ya Health apewe ya kukusaidia wewe ni ngumu. It is harder for us in the private sector to raise even 100 shillings. And if we have managed to raise $1 million to bring to you and you have not worked for it, even if you can't give me a cup of tea, the worst thing you can do is just say thank you and you go away. But not to tell me that nonsense. It is not good to have in 2026, a century after civilization started in Africa, to have a government officer totally being oblivious about gratitude and behaving like you own that office. After all, you're remaining with 2 years, you'll be going away. I told people here, there were DCs walikuwa hapa. One time we had a DC, DO in Kimilili, who was a very arrogant man. Nikamwambia wewe kijana, utoka nyumbani kwenu, utarudi kwa wazazi wenu. Wacha anaambia watu tukikawane hii shamba ya Kimilili government office. Ad Moya akasema Moya hajasema ni nyinyi mnamharibia. I told him no, we are not doing it. Akasema twende Bungoma. I told him ukigawa hii shamba ya Kimilili, I tell you, haikumaliza 2 months government system and he was interdicted. They have been, they come and go. Waziri wanakuja wanaenda. Wananchi ambao Mungu amewatuma kusaidia hii county, they should be given a welcome, a friendly hand to work with you to help with these people that are waiting. We don't need to be abused. We don't need to be harassed. We are not looking for your job. We are looking for a way to help that sick person access quality health care. Mnasikia hiyo wapendwa? So let us accept. We are living in a time, I was touched recently. I was talking to the professor in charge of nursing, faculty of nursing, Petersburg University in Pennsylvania last month. And he's a Mkamba from Kenya. He arrived, when I arrived, he comes, leaves his office from there and says, excuse me, sir, I'm very sorry I'm late for 1 minute to welcome you. Please forgive me. And na nimeenda kuomba. This is a man who has been trained in a culture ya maendeleo to receive visitors in a different way. Can we change that attitude? So mgeni akikanyaga tu Bungoma namna hivi, akiingia kwa ofisi tu ya Simon namna hivi, anasema tu hapo lazima niache 20 million. Kuna mgeni alikuja kwangu Dreamland namna hivi, and I have learned this art of welcoming people. Baada ya kutoka tu namna hivi, that visitor left me with 50 million shillings. You know, if you touch somebody's heart, you can't touch their pocket. Did you know that? And what we are sitting here for, we are sitting here to seek ways of receiving what is missing for Bungoma to be equipped, well prepared to serve that patient better. The partnership is not about who is senior, who is junior. In partnership, hata kama wewe ni mwanaume ambao unatoa mbegu, mimi ni mwanamke ambaye nabeba mimba, we are all equal. Ama namna gani? Are we getting what we are talking about? So this is something that we need to think about. One, what makes our county the partner of choice for healthcare? Secondly, are all partners aligned behind one county health vision? We are going to do it. We have been told that. Please, partners, mumeambiwa. Don't go and start mambo yenu. We have been told. Let's go and engage with these people so that we sharpen our minds to fanye vizuri. Ya tatu, what prevents partners from increasing their investment and engagement? One of the things that prevents partners from increasing their investment is transparency and accountability. Please, Waziri, I know that we are living in times, Mzee, we are living in times where people are in jobs for what they can get.
not for what they can do for people. May Bungoma start on a trajectory of reducing those mindsets, so that anybody who holds a strategic position is measured in terms of performance indicators, being there for what they can do, not for what they can get. Bungoma is now stinging, because you go to county government and within 3 months, 3 years, you have built a house that a professional doctor kama huyu amefanya kazi akipata mshahara 400 for 20 years hajajenga. Somebody amechukuliwa katika kijiji, mwalimu ama somebody within 2 years amejenga nyumba ya milioni 30. Pesa ya wananchi, na nobody is talking about it. Season of accountability is coming. Ulale hapo ndani, lakini wachukua watalala ndani hapo. Time is coming. You know, you are telling us about accountability, but let us ask, let us all be accountable. Let us all be accountable. Mimi, I have a problem. Hapo akisema kwamba there is nobody interested in SHA. As ICFM we were, when Bwana Wangamati, mimi siwezi kumficha hata akiwa hapa nitamwambia. Bwana Wangamati, when he was a governor, I went to his office. Nilienda US nikapata partner, na wakati tunakuwa tunaongea juu ya universal healthcare, karibu inataka kuanza. That idea was beginning. Na I got somebody to sponsor. We wanted to sponsor on pilot, mheshimiwa, on pilot sub-county ine, kila county, sub-county, tukisponsor. We did a study in Kimilili, tukapata kwamba the most vulnerable families are about 60,000 in Kimilili, ambao hawezi ku-afford vizuri SHA, NHIF. And I got a partner who wanted to do it for us for 10 years in Bungoma. Na Kimilili was going to get 90 million, and Bumula was going to get 140 million for SHA. Na hiyo pesa hili hospitali zetu, if we pay for the many people to get SHA, it means that we are going to get a lot of check from government SHA ikuje Bungoma, so that now our healthcare moves forward. We were prepared to invest about 10 billion shillings here. Nikaenda kwa huyo donor, alitaka nipate permission, approval, kwa sababu healthcare is devolved. Nikaenda kwa governor, na huyo donor alikuwa ametoka ngambo, mzungu, nikaenda naye Amerika kuongea na Bwana Wangamati. Alisiambia hiyo ni, that's a very good idea, that's a very brilliant idea, lakini wacha mimi mwenyewe niende niongee na first of all Didmas Kimilili ili akubali na tuanze pamoja. Nimengoja, nikangoja, nothing happened. Nikauliza Bwana Didmas, can we start? No, nobody ever came back to me. The only thing that I was told, tukiacha huyu mtu I finance our watu, the next thing atakuwa governor. Hiyo kitu ikapotea. We lost 5 billion ya SHA. Now we would be attracting, Bungoma would have been the example. Ama namna gani? Bungoma would have been an example. I lost the money. Families, I've paid for 50 families SHA for a whole year, so that they are not missing care because we are there. Here's what I'm trying to say. Again, what I'm trying to say is that imagine if we had 5 billion SHA, this country ingeongea juu yake. Ama namna gani? So what I'm saying here is that if we are not, nasitaki kusema what happened. Nasitaki kusema ati governor mwenyewe alisema. Mtu akakuja kwa ofisi yangu akasema wamesema ati kwa hiyo yao ni ngapi? Kwa hiyo yao ni ngapi? Hata nyinyi mko hapa kwa kabla hujafanya kitu na Simon leo bole mwana hapa. Ebintu bya biruruzo hatira hota. God will bless you in a different way. You think you are building a house, leave them alone. Leave them alone. How invisible are partner contributions and achievements? Does Bungoma recognize what partners do? Does it celebrate them? This meeting tumekuwa nayo to know. Can we have another meeting before the end of the year where you come and award the best performing partners? And even by awarding them just with a pen. I was talking with a professor of Harvard University, and after finishing, he put on his pocket and removed a pen. And he said, you have challenged me to think about Africa. And he gave me a pen. He said, take this pen as a sign that I've given you my heart. I'm waiting for you to say what Bungoma is waiting for. A gift like this, a pen only. Mara kunywele chai, tukunywa chai vile tumekunywa na mheshimiwa. Najua I felt so good taking tea with the waziri. Na tuende. Do you know it will make people to go and think? You go invite life care people, you take tea with them, and they can go back and come back with you and also thank you in another way by making your office work better. You see what I'm trying to say? So this is the voice of partners. We have heard the voice of government. Now this is the voice of partners. Ya mwisho, how quickly do we respond to partner needs and concerns? How quickly do we respond to partner needs and concerns? Sahi, some counties in this country, wanaenda to treasury hivi, wanapewa barua na wanaenda kufanya tax exemption ya vitu vinakuja kwa hizo county. In Bungoma, you can never get it. To get a letter from government here, tunataka ku exempt vitu. It is impossible. You see what I'm trying to say? We are in a position where we can even bring equipment and get Sirisha, Bumula, wherever equipment sikuje. Hata saa hivi naongea namna hivi, the regional director of health in Italy has equipment anataka atuletee Bungoma, na asema we cannot bring in Bungoma until you organize yourself in terms of taxation for the needy. I was bringing wheelchairs, 250 wheelchairs. Wakati before alikuwa minister, assistant minister. We needed a tax exemption. They refused. Minister MP wangu Kimili hakunipatia. Before hakunipatia. Before akasema tuko na mimi niko na disabled people tu wawili peke yake. When we went to Bumula to give wheelchairs, tukakuwa na 150 people wamekuja na wheelbarrow. Before naye uzuri wake akapika magoti anasema Mungu nisamehe. Na mtu ambaye alinisaidia ni huyu nani Wycliffe Oparanya. Wycliffe anasema watu wa Bungoma namna gani? Ukienda central vitu vinafanyika, wakiona kitu na kujia watu hao, they do everything, barua inatoka. What is wrong? Wycliffe akaandika barua ikaenda nini kwa ministry, wakanipa barua haraka quickly, nikatoa hizo wheelchairs, na Wycliffe akaniambia bila nilikusaidia watu wa Kimili wakataa, I need 50 wheelchairs, nimpelekea 50 wheelchairs huko Butere. What I'm saying is this: how friendly is our system? How friendly and how supportive is our system? How do we measure collective impact? What system must be strengthened today to sustain partner-supported programs? And how can we leverage faith-based sector and community resources more effectively? Members, yangu ilikuwa tu ya kuwachochea kuambia tumesikia upande wetu, upande wa serikali, na tumekubali, tumeelimishwa, tunakubali, tunaenda kufanya. Hii ni mkutano ya ajabu. Na sisi nasi kwa upande huu tumesema tuandalie kiwanja ili kazi ya Bwana ifanyike, watu wa Mungu wasaidike. Wewe ukienda nyumbani usema while I was a minister I made something in Bungoma. May God bless you.
Wow, it is true. All is gold and loaded with wisdom, and we have received it. Thank you so much, Director, for that. The next.
Okay, thank you very much. I think when we were receiving our powerful feedback, Honorable Member came in, and one of the leadership, and also introduced kwa ufupi.
Asante Waziri kwa kunitambua. My name is Joan Kiro, representing people of Kapkateny, and I'm a member of Health Committee in County Assembly.
Thank you. Karibu Mheshimiwa. The next, Living Goods.
Good afternoon. Waziri, honorable members, department leads, partners, MOH colleagues, CHPs, you know, and in case I've missed anybody, allow me to again just ride on the protocols that have been established. My name is Dr. Rosbella Mihanda from Living Goods, and just in 2 minutes, a little bit about Living Goods. We are an organization that has been in existence for 15 years. We have presence in 3 countries, Kenya, Uganda, and Burkina Faso. In Kenya, we are in 4 counties, expanding to another 2 in the next couple of months. We are in Bungoma, that is our youngest county, Kisumu, Vihiga, and Busia. Just reflecting on the past 1.5 days, some very strong foundations have been laid for us. We can strengthen that. What is not working, you know, and also looking at how well we can coordinate as partners. Looking at the presentations that have been made today, we now have a foundation on how to enter the county, how to partner with the county, how to partner with other partners in the county. We also now know how to implement, you know, who are our accountability partners across the MOH teams. We know how to exit, and that is not all. When we sat in the different groups, we discussed, and another foundation that has been laid for us is conversation. How do we leverage on what each partner is bringing to the table to make sure that we are not duplicating, to make sure that we are spreading these resources across each and every sub-county in Bungoma? Foundations for open conversations with partners in each thematic groups, and also breaking those thematic silos so that we can have conversations across the different thematic groups. Because our reality is, it is a whole human being who will walk to our facilities for care. It is not malaria that will walk in the facility. It is not TB. It is not HIV. It is a whole human being. And therefore, breaking those silos across the different thematic areas then brings us to a point where we are able to deliver holistic care to that human being. And ladies and gentlemen, our reality is that we are in the business of saving lives of the people of Bungoma County. What we do not do at the end of the year means that there is a family that has an empty seat at the dinner table. Whether it is a mother, an under 5, a young man or a man who has committed suicide, as we had some of the mental health statistics. What we do not want is to have an increase in those empty seats at the dinner table. And so we have been charged with the responsibilities of saving lives across the different areas that we are operating in, so that in future, when we hear mortality rates, they are going down for Bungoma. And that is our unifying factor as we sit here in this room. Recognizing that each and every person, each and every table brings some wealth into the ecosystem of health in Bungoma. You know, this room is very rich. We have experts. Resources are in this room. Experiences are in this room. Is there anything then that can defeat us? Of course, guided by the department. I doubt that, you know? And so the challenge for us here as stakeholders, if you're an MOH, a facility in charge, a program lead, a partner, and even the leadership, how do we unify all the resources that are in Bungoma County for the betterment of the people of this county? What we have done over the past 1.5 days is just but the beginning. This is the time we now need to roll up our sleeves and commit to every single conversation we've had. That phone call we intend to make to bring these other partners together, you know, that meeting we need to hold so that we ensure that every single person is served. That is where the rubber meets the road. It's one thing to talk, it's another thing to do. At the end of the year or after 1 year from now, when we sit to celebrate, I want to challenge us to also celebrate all the lives that have not been lost, because of all the efforts of every single person representing an organization in this room, and also each and every person who is not here, but their voices have been spoken through every single person that has spoken here. I just want to keep it brief and challenge us. May the next meeting give us more success in terms of how far we have moved and our fidelity to the roadmap, partnership framework that has been presented here. How well are we being guided by the department? How well are we synergizing? What are the outcomes? We have been challenged to measure. Waziri kept on talking about indicators. Those indicators are human lives. All right? So for us is to challenge each other and to bring our collective commitment to you, Waziri. We shall continue to work with your team. We shall continue to work with you. We shall continue to attract more resources for the betterment of the people of Bungoma County. Because at the end of the day, our business is saving lives and nothing more. Thank you.
Thank you so much. I think to close that session, allow me to welcome Dr. Wanikina on behalf of the Medisups and MOHS to come and make the remark.
Thank you, Mr. Ure. I want to say thank you for the opportunity even to stand here and say it has been a good 2 days of engagement. As MedSups, as medical superintendents of the various facilities within Bungoma County, we would like to say that this is it has been a nice caucus for us even to meet the partners and to say that as medical superintendents, we are receptive and all the facilities are receptive for partners, for engagement. Number two, we know that we need to improve our outcomes and we cannot make it alone without the partnerships. So we look forward even to work together to ensure that we do better for our people. I know that there are many things that we can achieve with the partnerships inside here. Today for the 2 days I've been here, I have listened to so many presentations. I have seen lots of opportunities that we have not explored at the facility level and even at the sub-county level, that we have a lot that we can do to improve the lives of the people of Bungoma. The other thing I want to say is you are welcome. I'm sorry that probably that happened at my facility. We, from the facility leadership, we want to say sorry. And you are welcome again and again and again. Webuye is an amazing facility and we are doing wonders there. So you are welcome. Let one person not destroy the good name of Webuye County Hospital. For all the other partners, we have about 12 hospitals, government hospitals in Bungoma County. All of them are receptive and all of them are an opportunity for us to work together. Maybe let us look at our data and let us use the data to inform our decisions on what areas we can collaborate better and what areas can we improve in terms of the indicators. I know that we are working in the various areas of collaboration, and there are so many other areas that we have not explored. I think already it has been indicated. I hope that we can still look for the partnership under SHA, because sitting at the facility level, finance is still a barrier to health access, despite all the efforts that we've made. Basic things like national identification cards have denied people access to healthcare. And even just registration of births has also denied people access to healthcare. How can we collaborate? How can we go into the community, ensuring that these people have these vital registration documents so that they are enabled to access SHA? Because I still believe that if we can sort out the financial barrier, then access across all the spectrum of healthcare, from the household to the level 5 also that we have here, access will be improved. Thank you so much, and may God bless you.
Thank you so much, Dr. Wanikena. On behalf of the Medisubs, Karibu Waziri. Can I help this one?
I think we are okay now. A 1,000 miles, one step. I started by saying we postponed this meeting 3 times. We almost lost it. But we agreed with the committee, let it be. As a department, I think this is one of the craziest week we have had as a department from last week. And we were even supposed to appear before assembly. We requested the members that we can't manage, and they accepted because of this day. Since yesterday, I think you have seen our request, and we have heard you also as to speak on behalf of others. I think we will discuss among ourselves to confirm. You could see and you could hear. It is a message of truth and it's a message of reality. It has indicated where we need to improve as a department and where the partners are supposed to improve on both sides. And this was the reason for this meeting. The reason for this engagement was to understand what is creating a barrier for future and for prosperity. That's what we wanted to know. And all partners who have spoken here, they are indicating that we are ready. And we want to move. So let us accelerate the speed. Engagement. Of today, the resources, because the partners are saying, we want to engage you, you are not. So our take home is anybody who become a barrier is an enemy of this engagement. That's what we are saying. This, what has happened today of engagement. And we wanted this day to be the turning point of our future interaction. What you have indicated here, all of them have been captured for implementation. I want to appreciate the partners who came today. I know there are those who have not come and they wish to come, but because of timing, they were unable to be here today. You have heard about the framework which has been highlighted in summary. That is our roadmap. That is a point of unifying our engagement. If you are playing in the field without any rules, you end up having no game.
That will be unfair game. And you will end up getting people outside the field scoring also. That is not what we want. We just want to know who are the players, and we want to know how we need to organize our players. That's what we want to know. And that is the reason we must have the rule of that game. We request you, we will share with you this document. Please put in your contribution so that we are able to finalize. Partners, the reason why we called you is just like when Ebola is now being discussed, we don't know whether we are controlling our borders or our entry points. But they are also saying we have panya routes. Those panya routes is what we want to close. We want to have a serious engagement where we want all partners to be treated equally and be supported effectively. As we have been discussing, there are things that every partner, and this is our ask, should be able to include into their daily activities and the engagement with us. One of them that we have agreed, which I want to put to you so that your take home, is that we need more members on SHA platform. That's SHA registration. Every partner should actually confirm to what extent they can contribute towards that direction, because that's where all of us are anchored. The second thing that we want every partner to consider is that CHMT supervision must be part of your activity in every partner activity, because the CHMT is the one that supervises all your activities. Their alignment into your document is part of success of that achievement of that program. The third item that we are saying every partner should consider factoring is the reverse referral support. While we have been discussing here, one of the things that is killing health is shortage of staff. Is that what we are saying? But when we enhance technology, then that shortage might not be there. And that's the reason why those who are dealing with technology, we have what we are talking about, telemedicine. Those are the innovations we want to bring to Bungoma. So those who are dealing with him, we want such a things on board, because you don't need to go somewhere far. You just connect to the doctor you want and will serve you from wherever you are. And that also brings into the technology that we have been taught about, ambulance, new guard. Those ones should be visible. And I think you have indicated very well our partners' activities visible. The reason for this engagement is to make every partner visible. The other thing that I want every partner to take home and ensure that they have aligned their activity is the issue of patronizing the blood drive. That one we indicated, let it be part of any partner's engagement with us. Blood is life, and let us take it as part of our engagement. I want to agree that we cannot get a solution to something unless we have carried out research. Research establishes the cause of what has happened. You cannot carry out an activity and achieve
without understanding exactly what happened. It must be scientific, because we need to do it today, tomorrow, and in the future, and confirm whether we achieve the same results. If not, it is research that can change that course. So let us appreciate by including something in that research, in that activity costing. In Bungoma, I also want to confirm a few things that have developed. Recently, I think all of you are aware that we brought in the CT scan, which is operational, and I'm happy within 2 months we have served over 450 clients, patients, and that means that we have contributed to life. I'm happy with the ICFM. I think the engagement on waste management disposal. As we are talking, I think we also have an incinerator. I think it was installed, functioning, and we believe with that, then our disposal is also managed in the proper manner, because it can generate a public health issue if not well handled. Partners, this is not the end of engagement. This is just the start. The future is bright. We have been told you still have more milk. I heard it properly. Please, the committee, the milk is still fresh. Please, I hope you know what I'm saying. It means you are not discussing deep with the partners. Please, after this discussion, the month of July, make sure every partner is engaged directly, so that we understand to what extent we can go. And in case of anything, let it be resolved accordingly. As we are doing this as our first start of engagement, we have also planned for a major medical camp in September. And we have also aligned it because around September, we'll also be doing an activity of level 6 here in Bungoma. And there will be a day only for partners. And that will be day 2. It will just be a partners day. And it is that day, Secretariat, you have heard. If there any partner who has performed very well, please generate a scorecard. We are not saying that the others have not performed. We are just saying we want to generate a scorecard. Please, we are asking, just like this meeting conference, partner supported, let us support this medical camp, because we want, if possible, day 1, we want it to handle patients with all kind of sickness, involvement, even share drive. Day 1 to be the real patient day. The second day, we want to deal with the partners clearly, so that we ensure that things are running well. The third day, we want to showcase the departmental performance, the department performance. The fourth day is a day for the governor, just to demonstrate the tone from up on the health direction. And the fifth day, we expect, if possible, the president to be around and the CS. That's how serious that medical camp could be. So I was moving towards there. I think the Secretariat, please let us move with speed to ensure that we don't postpone. You know, this one we don't postpone because it has already been directed. It's not like this one. Yeah, this has already been directed that it must happen within that period.
I don't want to dilute what we have discussed. We just want to ensure that we digest so far where we have reached and we review. Because the Secretariat will develop a partners book, which we expect that you will help to ensure that they capture your details properly. On that, I want now to take this opportunity to read the governor's message to this occasion. Actually, he was supposed to be here. He was supposed to be here. And I checked his diary before, and we agreed he's supposed to be here. But remember, we are not God, isn't it? We don't decide tomorrow where we'll be. And he indicated very strongly that he is in support of this summit. And that's why the Chief of Staff actually came to confirm that the Office of the Governor, the Governor himself, the team is actually in support of this, and they expect that we conclude it with a firm direction. I will read. Our esteemed partners, CCs, chief officers, distinguished partners, religious leaders, the healthcare fraternity, members of the Fourth Estate, ladies and gentlemen, on behalf of the people of Bungoma County, I extend my heartfelt gratitude to each of you for your presence and contribution towards during this summit. Over the past 2 days, we have shared knowledge, built consensus, and strengthened our collective resolve to improve the health and dignity of our people. We have confronted the reality before us, renounced constraint from the government, limiting our ability to fully meet the rising demand for health care, rapid population growth and increasing pressure on health facilities, inadequate sanitation infrastructure, the burden of communicable and uncommunicable diseases, limited human resource to match the scale of need. These challenges are not abstract. They affect mothers, children, families, and communities across Bungoma. And they remind us that only through partnership, harmonization, and accountability can we drive having solutions. In recognition of achievements, we also celebrate the progress we have made together. Expanded maternal and child health programs, stronger HIV, TB, and malaria interventions, nutrition and wash initiative, reaching more households, mental health services gaining grounds, digital health systems and supply chain improving efficiency. These achievements are proof that when we unite, we have lives and restore hope. This call to action, I think this is what feels should be done. This summit must not end with words. It must end with commitments. Finalize and operationalize the partnership coordination framework. This will be our guiding tool to eliminate duplication, harmonize reporting, and ensure equitable distribution of interventions. continue partnership to ensure service delivery. Let us deepen collaboration, strengthen trust, and ensure that every intervention adds value to the lives of our people. I further call upon the people of Bungoma to enroll in social health insurance, SHA. It is the surest way to guarantee access to affordable quality healthcare for every household. Our vision is clear. A Bungoma where no mother fears childbirth, no child dies from preventive diseases, no family drinks unsafe water, and no citizen in denied care because of poverty or disease. Distance. This vision will only be realized if we continue to work together. Government, partners, healthcare workers, religious leaders, and citizens hand in hand. As we crown this summit, let us live with renewed determination. Let us commit to working not in separate entities, but as one united health family. Together we can transform Bungoma County into a beacon of partnership-driven health outcome. Together we can ensure that every citizen in every village feels the impact of our collective work. May God bless you. May God bless Bungoma County. May God bless Kenya. Unajua sasa nikimaliza hivyo ni kama ame officially close the meeting. So mimi siwezi nikaongeza nika subtract because sijui angesema nini sasa hiyo nimefungia hapo. Sawa sawa, but I wish you well. Thank you very much.
Thank you so much, Waziri. That was wonderful. Another round of applause for Waziri Shwani. And before I bring a member to give a vote of confidence, vote of thanks. Okay.
I think while I was talking, an honorable member from our Committee for Health came in, maybe just to greet us.
Yes.
Thank you, Waziri, and key players in health, our partners in health. Sorry I'm coming late, but I've been sharing with my cousin here very closely. Mine is just to introduce myself because the speech is already, it has closed the meeting. My name is Honorable Ali Machani Mutoka, socially known as Honorable Balala, representing Maraka, a member on the Health Committee. Thank you, Waziri, for recognizing me. Thank you.
Thank you so much, Mheshimiwa. I was saying before I bring one of us to give a vote of thanks, I want us to appreciate Waziri in a special way. Are we together? And I'm just trying to look at where will my eyes find this person. But maybe the Spirit of God has touched someone to come and appreciate Waziri. The Spirit of God might have, before I come in. Who is that one, by the way? I saw, I'm seeing the hand doing this. Please, with all respect, I wish to welcome the person. Kindly come over. Somewhere there. But Wetoto was trying to make his hands
You know, Wetoto is one man we know that maybe after this world, Wetoto should be given a honorary office that leads that part. But now, you want to do it, eh? Please, welcome.
Thank you so much, sir. I think, may I request you just to stand up as we appreciate Waziri for the great work he has done. We agree with it. Tunasema asante sana. Even we as CHP, we are here. We feel warmly to be here in this presence. And also, we just want to appreciate for recognizing us and allowing us to be in this meeting. We say thank you so much. But before we do anything else, let us kindly do the appreciation because that is my work. That's why I'm here. Ningependa niwaulize ya kwamba ni kazi nzuri. Mkutano kama huu pia tumekuwa ndani na tumenyamaza, lakini tunataka kuona kwamba ni mkutano mzuri ambao umekuwa wa baraka, umetuhamasisha na kweli tumekuwa enlightened kwa mambo mengine. Na kwa sababu ya hiyo, singependa niwaulize tuwe na makelele. Maana waziri hana makelele, ningependa tu niwaulize tutafanya namna hii, hatuchapi ya kapchai. Naona huyu mwanaume hapendi makelele. Sawa sawa. Nataka tufanye namna hii, tutatumia mkuu yetu. Nitasema 1 2 alafu tunachapa 1 2 3. Sawa sawa. Alafu tukishamaliza namna hiyo tutatumia vidole yetu vitatu. Tutampea tena alafu tutampea marashi. Tutakuwa tumemaliza. Sawa sawa. Tuko tayari? Haya, 1 1 2 3. Haya basi tuko sawa, turudie tena. 1. Haya, tumpee ya makofi 1. Marashi. Asante waziri.
Thank you so much. You know, when I was saying possibly the Spirit of God has touched somebody, and the Spirit of God touched the roots of Waziri. Unajua hawa ndio madaktari mashinani ambao wanapeana waziri wetu ile uwezo wa kusimama dhabiti, so that he can be able to lift our vision high and high. The Bible says in Mount Zion. Fine, thank you so much. Waziri, with your permission, allow me to welcome Dr. Wankina to give a vote of thanks as we come to the closure of the bills.
Thank you so much, Mr. Ure. I think it has been a magnificent period, and it is visionary for the county of Bungoma. From the Department of Health, we want to say thank you to His Excellency the Governor by giving just a hearty clap. Tupige tu makofi kumwambia governor wetu asante. Wanasema hata kwa chief hii haitoshi, tupige vizuri. Tuambie tu governor wetu asante, even for giving us the opportunity as a department to hold this forum. Number 2, we also want to thank our CEC for Health, for the leadership and for the vision, and even for guiding us as a leadership to ensure that we deliver. We hope that this one will steer the department to even greater heights. We also want to say thank you to our chief officer for providing an enabling environment for all of us to ensure that we express ourselves and to ensure that the department is functional. Number 2, I also want to thank our members of the county assembly. Tuwapige makofi tafadhali, for facilitating us and giving us a shoulder to lean on. You are our pillars as a health committee and the entire house. Thank you for giving us a hand, and thank you for working with us as a county department of health and sanitation to ensure that we deliver. We believe that with this stakeholder forum, partner summit that has happened, there are many things that will be achieved. For the partners Tuwapigie makofi partners wetu tukiwaambia asante. Thank you for the good work that you've done in Bungoma County. Thank you for supporting the summit. Thank you even for the collaboration. We believe that the coordination framework that we are building will ensure that we work together in a coordinated way so that we have a shared vision and we move together so that at the end of the day tukipeana, nasikia kuna scorecard, tumeambiwa kwamba hiyo scorecard, I am hoping kwamba hatutakuwa wa mwisho, sisi wote tutakuwa, wanasema siku hizi hakuna yule amepita sana na yule, wanasema sisi wote tutakuwa tume-exceed expectations. So even as we work, let us all exceed expectations for the people of Bungoma so that when you look at the health indicators within the county, we are ranked the best nationally. This is a challenge for all of us. So we are grateful for all the partners in the house for heeding the call to attend this partnership summit. We are also grateful that for your commitment that we are going to work together to make Bungoma health great. We also an applause to the CHMT tafadhali, tukiwaambia tu asante, wamefanya kazi mzuri. For all the CHMT members, this is to say thank you. Thank you even for the planning. Thank you for the thinking and for the sleepless nights. You still have kazi mbele. Tumeambiwa kwamba lazima hii ikuwe complete. Sasa tujamaliza, tumewapatia makofi, lakini tuendelee kuwork so that we ensure that we achieve together. I think we've been challenged by our partner that there is a lot to be done, even to make sure that we are attractive. We also want to thank all the MOHs in the house for coming and for all the support that you accord the partners within the sub-counties and ensuring that healthcare reaches the household. So tunasema asante for all our MOHs. Tuwapigie makofi tafadhali our MOHs. We and medical superintendents, we value you. We also have the chairs and CHPs. Hao ni unajua wamesema they are powerful. Hao ndio the roots. Without them we cannot succeed. Tuwapigie makofi tena hao pia. Just to say asante. We had our religious leaders and CSOs. Pia tuwapigie makofi tafadhali. Tunasema asanteni sana for supporting the department and even for coming and attending this partnership forum. You've added value and we believe that together we will succeed for the people of Bungoma. For the hotel management, for providing these amazing facilities, we also say asante sana. And may God bless all of you. Asanteni.
Thank you so much. Let's appreciate Dr. Nonkina for that good, wow. Okay, thank you so much. Now we are coming to the end of our summit and I want to make a few announcements. We have lunch. It's already there, waiting for us. After prayer, we shall proceed and take our lunch. And in that mood, I'm preparing one of our religious leaders. Of something. Finally, on behalf of the Secretariat, Waziri, I want to say thank you so much for giving us this opportunity. And everybody, we love you all. May God bless you as you go back. And may God lift you and continue giving you.
As we break for lunch, we shall have a media briefing and all of us we shall flank Waziri. Waheshimiwa, tutaulizwa maswali, tuwaongeleshe. Na baada ya hapo, as we go to our lunch, we do networking. Tubadilishane numbers so that we keep on working together. Asante.
Thank you so much, Chief. I'm also reminded we shall have a group photo outside there to remember this session. So I think we shall move for a group photo, then we shall have that, and then we go for lunch. Otherwise, God bless you. We love you.
In the name of the Father, the Son, and Holy Ghost, in Trinity, you are one living God. You are one living God. We thank you for this meeting that started yesterday to today. Lord, it was under anticipation, but now reality, we have seen your hand of blessings upon us. We commit the leadership before your able hands, that Lord, they have been running up and down for this meeting. And Lord, we have seen your blessings resting upon each one of them. We commit our CEC before you. We commit our chief officer before you. We commit all the county leadership that's present before you, that they have an enormous task. Lord, as they stand to serve people you have put in their hands, you shall stand along with them. Thank you all the partners that are here. We remember all the religious groups. We remember all the CHPs. We remember all the sub-county leadership. We remember all our partners in health. We remember all the FBO and even all private hospitals, that Lord, they are here for purposes of unity and for purposes of discussing how best they can support people that you have put in their hands. We pray that, Lord, you shall brighten their future, open ways and avenues for money that they may get to support all the community members that will go into their hospitals. We know that we have lunch that's already prepared for us. And we pray that, Lord, you shall bless it before we partake, and that you shall open ways for others elsewhere to eat and drink like us. Thank you for those ones who shall leave after this meeting, and this place shall leave for various travels. Others shall use planes, others shall use the road, and others shall use different means. We pray for your blood of Jesus to rest upon each one, that when they reach the places of destination, we shall uplift your name high. We thank you, Lord, for the answer. And in Jesus' name we pray and believe. Amen.
Thank you. I'm reminded, please don't leave your personal effects on the table. Just as you go together. As you explained, group photo. You are welcome for a group photo. Yeah, we can go and greet more outside when we have arranged ourselves for a group photo, so that we don't do our lunch. Thank you so much.
There are many.
Yes, yes.
Yes. Start with the introduction. Okay, thank you very much. I'm CPA Crispinos Baraza, the CEC for Health and Sanitation. Today, we are here on Partner Summit, which we started yesterday. That's 18th and 19th with the planned. The main theme of this Partner Summit, that is partners in the Department of Health, about strengthening partnership, harmonization of the programs, accountability of the same program for the purpose of improving the health outcomes for Bungoma County. The key issues that drove us to this summit is actually, first of all, to register all the partnership, map them across the county who are actually running our program, the Department of Health, and also ensuring that we harmonize their programs. The reason being is that we wanted to ensure that there are no overlapping activities on the ground or conflict or uncoordinated activities, so that whatever deliverables that they need to give to the county, they are visible and we are able to account for them. So these 2 days was actually to agree with them as County Government of Bungoma and the partners on which approach or engagement framework we need to have, so that at the end of the day we are having a united and common implementation of programs. And that's the reason why we have agreed on partnership framework, which will now undergo validation with them. Then once it is done, then it defines actually now the cycle of engaging partners from inception to actually exit from the county. And the reason for this is now to provide sustainability. If the partner has come into the county as implemented programs, how do they exit the county? This framework will ensure that there is continuity, because it doesn't mean that when the life must continue, and therefore we must have an exit strategy. And that is exactly the main reason why they're here. So to ensure that we actually create an environment where we are Bungoma, the Department of Health. This environment is through continuous engagement and holding more future meetings, and this is going now to be defined by this framework we're talking about. So that is the reason why we're here today. Thank you very much.
Perhaps in a view, how yesterday and today?
Okay, the challenge that has been there is a question of how do we know that activities are going on the ground, and how will I position myself as a CEC to be part of those activities. So we want a situation whereby as I participate, I've already known that is going to happen, so that it's not coordinated. That's the reason why we wanted to agree on that.
Maybe was it besides today's event, maybe concerning the issue of Ebola, how prepared is the county concerning the issue, because Bungoma being one of the counties that are in danger?
On the issue of Ebola, I think is under an organized arrangement, and as Bungoma, as we are talking, we have a team from national government which has been doing the training of our RRI team here in Bungoma, and I think it's ending today, so that to prepare them on how to respond to this in the need. And two, there's also another team that is doing assessment across the county to ensure that we are prepared in case it happens. So out of that, then we also have a coordinating committee in the county headed by the director. So we are in close collaboration with the Ministry of Health and also with partners who have come to support us.
We note that there's been withdrawals from funding has gone down, and some partners withdrawing, or the services are coming to the near end. How much is this affecting the county?
From the analysis we have had since yesterday, we have realized that we have even more partners who are around, and those who are exiting because of the period, there are those again who are plugging in. So we wanted a situation whereby when you have a common theme around the same program, you join hands. When you are leaving, another one picks in the same frame. So few those programs that have left, we have also others who are already running the same environment. But we wanted to harmonize so that we don't have a gap. Yeah.
And finally, because Waziri are here, a number of mothers are losing their lives while giving birth. What is the county doing to remedy this?
We are having what you call the MDSR meeting, where we're doing a surveillance on all the deaths, and audit is done. In fact, every Monday we are having a meeting. Any death that is happening, every facility must explain how did it occur, so that it provides a framework of response to that case. And Bungoma, I think the last 4 months or so, we didn't have any death. In fact, most of the deaths that are occurring in Bungoma are from outside, and that's why we are now having in the departmental, that's inter-county. We are now invoking the inter-county meeting, so that we want them to explain what is happening from where they are coming from, so that it happens that they come when they are in a very critical situation while they arrive in Bungoma. So that's the next step we are undertaking.
Labda tu Waziri, tukimalizia swali moja tu, ujumbe wako kwa wakazi wa Bungoma mnapokamilisha kongamano hili, wakazi wa Bungoma watarajie nini hususan masuala ya afya kina mama?
Sisi nataka kuambia wananchi wakazi wa Bungoma kwamba hii mkutano ambao tumekuwa nayo leo, tunataka kwanza tuweke wazi partners ambao tunakuwa na wao, kwamba tutapata ile service ambayo tunahitaji kwa community nao iwe improved further. Kwa sababu vile tumeongea hivi, hao pia wameelewa kwamba wanahitaji tuwe pamoja na wao, na hao pia wanahitaji tukue karibu. So hiyo collaboration is going now to give more service to the people, because there will be no overlapping and there will be no conflict when delivering service to the people. Yeah.
Thanks. Thank you.
Hapa tunaweza kuja hapa kidogo.
Mimi
wewe
mmekuwa na wakubwa na mimi mnataka kuniweke kwa siasa.
Hapana.
Msiniulize anything to do with politics.
Not politics.
Ni afya tu. Sasa nyinyi kila nani? Naona tu kamera lakini nyinyi kila nani?
Karibu niseme sisi ndio kila siku.
Siende kwa siasa.
Hao ni hao.
Ni hao. Okay. Huo ndio nashika. Mimi naomba basi. Yeah.
I would wish to have a word with you after this focus. And I do believe president after this.
I hope it's peace.
It's not now that I've come to it.
Thank you, sir. Kuja tafadhali. Sasa wewe hata wewe mkubwa kuja bwana. Mimi ni wa ukoo bwana yako. Kuja simama kando. Hao najua anaweza kunifanya nikatoa jasho.
Briefly tell us your name, your organization, and what you are doing here today as one of the partners in the Ministry of Health.
Mimi naitwa Solomon Nabie. I'm Mr. Solomon Nabie. I'm the Director General of the ICFM Mission, Inter-Christian Fellowships Evangelical Mission. We are working in the community, and with me is my colleague.
My name is Wilkista Mtoka. I work as an assistant director in charge of programs and projects in Inter-Christian Fellowships Evangelical Mission. Thank you.
So what are we doing here today? We are a part of the partnership team that are offering healthcare support in Bungoma County. We had been invited by the Bungoma County Department of Health and Sanitation as a partnership to come and deliberate on the roadmap of how to make effective partnerships in healthcare in Bungoma County. So that's what we have been here for the last 2 days. Yes.
Very.
Tumemaliza. Thank you, great young men.
Hello guys, kumbuka ni ikiwe updates na this round tumewaletea hapa tukiwa place ingine safi sana. Kwa sababu ya maneno mingi sitaki kuficha hii place, tutaki tutambue hii place. Leo tumekuwa shughuli ya hapa na pale, na napenda kusema masubscribers wetu mazee, ukiwa pale online ukiangalia ikoikwe, ama ukienda pale YouTube ukipata ikoikwe, ama ukienda pale Facebook ukipata ikoikwe, ama TikTok ukipata ikoikwe, mazee subscribe that link of your YouTube of ikoikwe. Please subscribe that YouTube of ikoikwe. Ukiwa pale Facebook share mazee, share na wasee bana, angalia mabeste, share kwa magroups mazee. Mtu ambao atashare mob kuna zawadi nakwambia. This round tutaangalia the top 1 followers. Top 1 followers hapa Bungoma County. Tutaangalia top 1 followers hapa Bungoma na tutawazawadi. Thank you for watching our live video. Nawashukuru sana, mnakwambia mmejikaza sana mkaangalia, tukumkoona. Nawashukuru, yani sina la kusema. Thank you for watching Ikoikwe update every time, every hour. Angalia Ikoikwe is the best media in Bungoma County. Sisi ndio wale wabaya bana, unasikianga wabaya. Angalia lebo inasema Ikoikwe updates, the biggest media in Bungoma County. Goodbye. Kata.